Good afternoon, everyone out there. Just reflecting on what we're all experiencing around the district offices today reminds us that the pencil changed everything. And as we know, a pencil and a dream is all you need. So, I mean, we can talk about the pencil a lot, right? You know, there's like 8 to 10 layers of paint on a pencil, the engineering of the ferrule, the barrel, the compound, graphite structure. But in general, we've made it today, and we're not as reliant on technology. We really just need our imagination and our discerning powers. Really, the computer just gives us efficiency. So, with that in mind, we are here on this December 10th, 2024. And I just loved walking through the corridors, seeing all the decorations around the district offices. Pretty amazing. So thanks for bringing that holiday spirit to all of us as we came through the doorway today. So I would like to thank everyone for being here. Thank you to our staff for being back there and being present with us as well, as we need you, and I'm appreciative of your accessibility to us as well. So we're humbled to serve alongside of you. And I say this every time, alongside the most highly educated and dedicated workforce in America. So I would like to start by reading our Who Are We statement. And we are the Polk County Leadership and Governance Team. If we were to pick one phrase to define us, it would be student-centered, because when we come together, we lean on our diverse backgrounds and experiences to ensure that our decisions are focused on providing a high-quality education for all students. The four most important things to our governance team are: 1, operating with integrity; 2, respecting our students, staff, and families and each other; 3, establishing a culture where stakeholders feel valued, they're supported, and have opportunities for personal and professional growth. Number 4, supporting an approach of continuous improvement to ensure student outcomes. And then collectively, we have to work together and on behalf of our students. And we serve and we find avenues of agreement so that we can govern the district in an effective manner. There is no acceptable alternative to that. We will always collaborate in a respectful manner in order to enhance opportunities for each student and staff member. We will not disparage others. Our students will thrive because when we remain committed to supporting the whole child, that's when success happens. So we hope to engage and empower our students and our stakeholders to create this community of lifelong learners. So at this time, I'd like to hand it over to Superintendent Hyde to lead us in our work session today.
Good afternoon. Good afternoon. Nope. My mic's on. Is it coming across the speakers
There we
now?
go.
Okay. Good afternoon, Mr. Chair, members of the board, members of community and staff. Thank you very much for being here today for the workshop. Our first item before us, I'll bring up Leanne Bennett and Ashley White. This is a continuation or renewal of our farm workers grant. So, Ms. Bennett.
Grant is for $316,260. This fund provides full-time staff who are responsible for recruiting, maintaining, and operating the program, along with managing student participants. The program offers students assistance with tuition and fees, and stipends that are directly provided to students for their hourly attendance, achievement of measurable skill goals, and career placement. Additionally, it can be used to offer emergency support for educational-related expenses on an as-needed basis. The project is from July 1 through June 30th, and the target audience is our CTE students working to gaining technical skills for employment. Does anybody have any questions? All right, thank you so much.
Mr. Keys, just as a point, no, you're good. Just as a point of reference, being a new board member, the board typically has asked me to bring forward any grants that would be $1 million or more. However, this is a grant that we continue. It's a reoccurring grant. It renews each year. So I will typically bring additional grants before the board, even if they don't hit that $1 million threshold, just so you're aware. Because I think we do believe in transparency. We want you to be as familiar with these. And more importantly, we know that we don't necessarily have a huge audience each time, but we do know that we get good viewership on our YouTube channel. So it's imperative for us to get that information out. So I just wanted to clarify that. Yes, sir. The next item we have before the board today during our workshop is New Beginnings High School Satellite Campus Expansion Request. And Ms. Amato, our Senior Director for the Office of Charter Schools, will do the introductions.
Good afternoon, everyone.
Good afternoon.
So I have presented to you on paper format now the New Beginnings High School contract modification along with their presentation and seeking their Four Corners expansion. Late, right before the meeting started, I did provide you with some data that the school has shared in regards to why they selected the Four Corners hub. So without further ado, some very, very familiar faces for you. We have Miss Ashley Wright, the founder, along with Ann Tankston and Dr. Gwen Kessel, who will be doing the presentation.
Good afternoon.
Good afternoon.
It's really exciting for me to be back here. Having spent 38 years in the district, always an advocate for the underdog and the students that were not meeting their needs in a traditional setting. So it gives me great pleasure to share with you that New Beginnings High School is proposing to add a hub on the Four Corners in Polk County to give about maybe even as many as 500 students the opportunity to have a new beginning, to have an opportunity to be successful in a school setting that is personalized and really geared towards the individual student who probably has not been successful in a traditional school for many reasons, for personal reasons, financial reasons, learning reasons. So we provide them with a great opportunity, and we're hoping that you'll agree with us. As I said, we select students, or we encourage students to come to us that need a new beginning, that have been marginalized by the system and just really need a personalized program that will help them be more successful. And I think we're doing a pretty good job at that. We have approximately 3 campuses, and we serve about 1,000 students, which I think is pretty remarkable. And through those 3 campuses, we've been able to really help kids be successful and have a second chance. So we've got some data to share with you on that I think will even encourage you more to support this proposal.
Good afternoon. I'm not going to tell you how many years I spent in Polk County because I know you're not going to believe me anyway. But however, it's an honor to be here today. We provided a lot of information for you today, but because of the time, we want to just spotlight some of the information to support the charter modification request that we have in front of you today to open a hub in the Four Corners area of Polk County to serve at-risk students and to answer any questions you may have. Paying attention to that first slide you see up there, currently our current enrollment right now as of today is 1,137 students. And that might be a little different than what the slide says because taking in consideration that we take students in at New Beginnings every day. Prior to, during, and after the FTE surveys periods. So we are constantly taking students trying to meet those specific needs. You will see we do serve grades 6 through 12. We serve a diverse group of students, Black students, white students, Hispanic students, Asian students, and any student that show up at the door. We have a special needs population. We serve ESE students, and we serve ELL students, and work very hard to meet the needs of all those students. You can see that most of our students are actually overage students. Our peak enrollment actually has been up to 1,296 students, and that's a lot of students to serve. Okay. The enrollment trends, as you can see, the enrollment has steadily increased over the years. You can see the slide there that shows that there has been an increase over a period of time. And of course, you look at this last slide here of 1,137 students, and the hope is that we are going to get up to higher than we were at this 1,280, because that is just current enrollment right now. So as I said, we're taking students every day, so we expect that enrollment to increase. As we said, there are 3 campuses right now, and the hope is to open that hub campus in the Four Corners area of Polk County to serve approximately 500 kids. The school improvement ratings, we're working hard on that. A lot of that, is tied to the number of students that we test. So we know that we are not testing as many students as we need to test, because testing is important, because it shows us how students are progressing. But we're working on that. That is one of the focus that we are really, really working on, trying to work with testing more students. But when you work with at-risk struggling students, getting them to test, first of all, is really a challenge. It's hard because they don't want to test. When you tell them you need to test today, why? I want to test. Why you don't want to test? Because I don't feel like testing. But sweetie, don't you know if you don't test, you can do all the coursework and you're still not going to get a high school diploma. And that's what we're all about, getting high school diplomas for kids. So it's challenging, but we're working on it, and we're going to do better. I promise you. Okay. Notice in this particular slide, we talk about the non-graduates in the regular traditional high schools. But I would like to just share with you that looking at the graduation rates that have improved over our district, we still have a substantial number of students who are not graduating with their cohort. So if we look at that and pay close attention to that, we will see that approximately 418 students per year don't graduate with their cohorts. And that's a lot of students who don't graduate. And so working with those students at New Beginnings, we do help with some of that. Because if we look at the next slide, we'll see that since its inception, New Beginnings has graduated 1,000 students who did not graduate from the traditional high schools with their cohorts. Now, all of these 1,000 did not graduate on time with their cohorts, but you know what? They did graduate. So whether they graduated with the cohort or whether they came a year later, they did graduate, and that's important. Last year, about 72% of those seniors that we serve did graduate with a regular standard high school diploma. And that's great. That's saying a lot, because a lot of these kids don't graduate with high school diplomas because they can do the coursework, but oftentimes they don't pass the test. So that's a real focus of getting them to pass the test. So a lot of kids would have been left behind had they not attended New Beginnings High School. Looking at the staffing plan, all I can say is that the staffing plan at New Beginnings High School does support the mission and vision of New Beginnings High School. There are enough people to serve the students and provide those services that student needs to enable them to be successful. Wraparound services. In the traditional high school, we do provide some wraparound services, but at New Beginnings High School, we provide a lot of wraparound services. You would not believe the kind of services that are provided there. I was really shocked when I went over there. I go, are you doing all this? You're going to send somebody to pick up somebody, bring them to school, take them home when they don't have a ride, and do all that stuff that we were not accustomed to doing. But of course they do that because these students need those services. And about 89% of all the students at New Beginnings High School receive some kind of wraparound services from the school. And these wraparound services are very, very important to these students because these services address the individual needs of not only the students, but of the parent of those students, the families of those students. We go out of our way to do things for the family, for the siblings, for for the cousins and the uncles and everybody who support those kids. And that's just what we do because we know that these kids require all of these services if we expect them to be productive citizens. At risk. All of the students at New Beginnings can be considered or identified as at-risk students because they encounter so many challenges that enable them to be successful. So our at-risk students at New Beginning face very significant barriers to meet the academic needs that we have set forth for them as they navigate the many expectations upon them as high school students, and the main one being to graduate from high school. These students, these at-risk students, require extra support and resources to be successful. And I'm not going to read them because you know them by heart, I'm sure, because we all experience those, and all at-risk students experience these same things. And all of the at-risk students are not at New Beginning. They're still sitting right here in our district, and all of these students belong to us, whether they are at New Beginnings, Ridge Community, Winter Haven High School, George Jenkins High School, Lakeland High School. Everybody got a whole group of at-risk students. So all we're trying to do at New Beginning is to help some of those students become successful citizens in our communities. Because when kids are successful, they get jobs, they help all of us. They pay my Social Security, they pay yours too. So we want all these kids to be successful because we want them to get jobs and work so that they can be successful in our communities. The interventions at New Beginning are research-based, and the emphasis on small group, differentiated instruction for these kids, guided questions, answers, test prep, and all of the other interventions. Through interventions, our students get a second chance at being successful. And there's a list of those interventions you can see. Effective interventions for these students are included in, of course, the list that you see there, and you have that information in front of you. So I'm not going to go through all of that.
So actually, I'm going to ask that we pause here. The intent of the workshop item is for them to seek approval for expansion. And I believe that they've addressed the topic fully, which is they continue to see increasing enrollment. There's a growing demand in the northeast portion of our school district. If the board wants additional information about Bridge Prep and about New Beginnings and their programs, happy to bring that forward at another meeting. But it seems like we're blurring the line here of what the workshop item was intended to focus on. So I'll go ahead and let you close out with anything left that you may need to share with the board, specific to the expansion. And then we'll go ahead and ask the board if they have any questions for you.
Okay.
Thank you.
Ms. Wright, you want to address some of that?
I'll be glad to. Yeah, so to the superintendent, thank you, superintendent and board. Ashley Wright, glad to be here today with me, as well as our CPA, George Marecki, and some other members of our team. Are there any questions that the board has for us specifically around the Four Corners expansion? You provided some data. Right now, we have about 132 children who are coming from that area already, who are already enrolled. And so we really want to help accommodate those students by having a location that's more feasible. We think that'll also help us with getting our testing percentage up as well. But when we look at New Beginnings, we're one school. Multiple campuses, but one school. So when we look at that increase of 500, we're already getting letters from the district saying, hey, you're over your 1,000, you're over your 1,000, but I don't believe in turning any child away. And so the team who supports us, we take those children, whether we actually get FTE funding for those children or not. But our ask today is to be able to up our enrollment modification to 500 for this Four Corners and our general enrollment as well.
And board members, please note that their current contract does allow for that. And that was the first question I posed to Ms. Amato. when the request came in was to ensure that they were already at a certain capacity, and the justification was there for them to bring an item before the board for expansion. So, and we've worked very closely together. We've had some great conversations, and quite frankly, we share a commitment to our students, regardless of age, regardless of situation and circumstance. Very pleased that we've been able to afford them some of our STEM opportunities, some of our STEM programs that were being removed from a certain school. So we went ahead and partnered with the school to make sure that the students had similar access. We've also been in discussion about affording their students as an incentive to continue to perform at a high level, the opportunities that should they want to go to Travis or Ridge part-time, so long as they meet certain criteria, they would be able to do that during the day, and we work with the school to address those needs, because again, at the end of the day, we all have an investment and a benefit. We all benefit directly from our students graduating with a high school diploma. And in particular, for some of our students who may want to pursue one of our trades, what a fantastic opportunity for them. So,
And can I
earning
add to
potential.
that as well,
Please,
Superintendent? You've been
please.
extremely helpful, and your staff. You've also been helpful with us with testing as well. So in the conversation with the super, it's like, how do we get that testing percentage up? And so we're in lock sync about where we are as far as who we are as a school, how we need to work with the state to change who we are as well, and then partnerships here in our district to better service these young people. So thank you, super.
I see Ms. Miller.
Good afternoon.
Good afternoon.
Thanks for being here. Wow, what a plethora of wisdom and knowledge, historical content behind that podium. I just want to say I appreciate both charters today are, and we've talked about this before, are complementary to what we do. The reason you're asking for this expansion is because the success you've had, because you work with a group of students who need a defined way of learning and follow up and social services and all the things that go with it, and you're providing that. If you're a board member and you haven't been to one of the graduations, it's probably one of the most inspiring events I've ever attended. And I can tell you the service is being done. And a previous board member, Sam Killebrew, and I, probably at that graduation, talked about the students to try to help them sooner. So when I sit at a middle school and I have half a page of overaged kids, I know when they get to high school, they're struggling. And so I want to compliment also the superintendent and his staff, the fact that we work parallel together with your school to make sure kids are, because they are kids, and to break the circle of poverty is employment and independent and gainful living skills. And I think that you contribute to that as a school, and you are going into an area similar to the next charter coming in, the same area, that the explosion of growth is showing this need. So I am happily support this expansion, and I haven't been out in a while, so invite me back out, and thank you for what you all do there.
Anytime.
Ms. Fields.
You. Hi.
Hi.
It's so exciting to see this vision come to fruition. And there is a tremendous need on that side of the county. And as a matter of fact, Ms. Hanks and I have had a conversation, because we have a young lady in our church who is actually one of your students. And she is in Lake Alfred, Winter Haven. So being able to make sure that we expand the services beyond specific areas, I think is great. I would say that the presentation that you all provided today is very much in depth, and I would probably have some questions later, and I'll circle back on that. But I want to thank you all for being here today, and I'm very happy to see Ms. Tanks, and she's hiding behind you. But we're very happy to have her, and I'm happy that you have the team that you have formed in order to serve the students to the best of their ability and yours. And I wanted to also thank the superintendent, because I know you all have had conversation months ago on how you all can partner together. So Superintendent Hyde, thank you for that.
Yes, ma'am.
Thank you.
Mr. Keys.
I also want to say thank you for being here today, kind of echo the other board members. Being from that part of the county in the Northeast, I know that the growth is there. I know there is a need, and I thank you guys for identifying that need and saying, hey, we need to offer services on that side of the county, where sometimes we don't realize how much the growth has been unless you drive there. But thank you for being here today. Thank you for the information, and thank you for your ongoing support for those students that are kind of in that gap. I appreciate that.
Thank you.
Thank you all very much. There are no further questions or comments. I appreciate you being here today.
Thank you, sir.
Next item is Victory Ridge Academy expansion and contract modification. Ms. Amato.
All right, good afternoon again. So today we have Victory Ridge Academy, which is also seeking an expansion in the Davenport area. So at this time, I will turn it over to the Executive Director, Steve Whitaker, and his team.
Excuse me, good afternoon.
Good afternoon.
Make this short and sweet for y'all. Why are we expanding to Davenport? Well, if you haven't driven in the area lately, you would know, right? When we contracted with y'all years ago for transportation, basically what we did was every east area of Polk County, basically any family that we could serve, basically were transported to us. In 1819, when the transportation was done, we were blessed to have one more year, 1920, to be able to transport those students still that we were serving all those families on the east side. When we became our own transportation, then took over our own transportation, we couldn't turn those families away. We've already established a rapport in all the communities on the east side, so we just continue to serve those families, and here we are today. Those families, some of those students and some of them, we have at least a third of our families that are in, I'm just going to type and not even worry about this presentation. Most of about 100 plus of our families are in the area of Haines City and Davenport. Some of those students, when we say we're a pre-K through 12th grade, a special needs school, some of those students are in car seats because we have students that are in pre-K that are being trained, and it's almost an hour and a half one way. And we're talking only 22, 23 kids per bus at the max. It's just too much to ask for those kids and for those families. But they 100% will put their student on that bus because they know that they want to be served at our school because we do such a great job. We have such a phenomenal team back here. Dr. Amy Brown, who's my principal, and Dr. Tempe, who is our director of therapy services. Really, she does pretty much a lot, everything at our school. And then Gannon Olmer, who is the contractor who's helped us in Lake Wales and is helping us in Davenport. And we have just an amazing team of about 180 staff for 210, see, I'm well, for 315 students, 317 students. So again, what we're looking to do is take the same model of what we have in Lake Wales and replicate that in Davenport. Still serve the same amount of students, about 300 students there, same model. We currently have about 400 on our slide. It said 125, but we currently have 415 applications.
We receive an average of 52 applications every month. And unfortunately, we are having to share with families that we look forward to servicing you in the next 2 to 3 years because of the extensiveness of our waiting list. So we're excited to open up another location to service more individuals in the community.
You think
No,
Okay.
yes, sir. Make it.
Just want to make sure.
Yes or no? No.
Ms. Miller.
Thank you. Thanks for coming today. Victory Ridge has been part of this community for a very long time and has a lot of community support. I want to go back a little bit for maybe people watching who don't understand what you do. You not only provide education to students with profound disabilities or our most significant students, but you provide medical grade therapy. That is something we do not do in the schools district because it's not funded that way. I can tell you what Stephen has done with billing for that services and providing equitable services in an ethical manner has been something that's not been replicated here in other areas. When other people have good intentions and try to do it, it really is difficult to do. When you talked about staff to student ratio, that is difficult to fund. That's why a lot of people who get in this business cannot maintain it because it is these students are your most expensive that need the most intense care. We've talked in the past being 400 on a waiting list plus 400 plus, and the Davenport area is the desperate need of growth. It's needed throughout this county. So I appreciate what you do at Victory Ridge. You know, there was a tough conversation about transportation. You were one of the only at the time, I think, that was able to go to their community and build that support in Lake Wales, which you did very easily to provide transportation and not turn people away because were not able to afford that. And pulling them in from as far as Davenport, it has been a great expense to this school for a very long time. So I'm happy to support the expansion into Davenport. Davenport. I'm looking forward to the expansion of what you do in our community because these are also our kids. Many of them are gainfully employed or can be gainfully employed. And I can say working with Stephen in the past, we've also came to a place where the district is working parallel in our transition programs. Something that you do well, the community should know, is that beyond transition, you work with students as they grow into adults. And the only other school that's doing this with this population is a private school that I know of in Jacksonville. So you are leading the state in this, and you should take credit for it. And I'm looking for your expansion in Polk County to service people living with developmental disabilities. Thank you.
Mr. Sharpless?
Mr. Whitaker,
Yes, sir.
how are you doing?
Fantastic. How are you?
First, I just want to say thank you as a Lake Wells resident. Just this, what you do for the students that you serve is truly remarkable. I can tell you that your reputation in the community, individually, but as well as the school system, your school is one of high integrity, and so I have no reservations with supporting an expansion into Northeast where it's desperately needed. So I don't have a question. I just have a comment. I just want to say thanks.
Appreciate it. And really, it's for the students and the families and what they have to go through. And we're just blessed to be able to serve and continue to serve those. That's so I appreciate it. I'm just blessed that I'm being able to do what I can do.
There are no further questions or comments, but I'm looking to see if Lori Allen is in the audience. I don't see her there, so hopefully she's watching this. I'd like to have some further conversation with you and your team. I think there's an opportunity here for us, for our students, especially those that are pre-education and have an interest in that, and that this would be a great opportunity for us to provide you with some interns. And there's a high school very close to where your construction is going on. I was just leaning over and spoke to Ms. Miller. You're in a highly congested area, so.
Yes, I watch it. I'm there every day making sure our.
So get your email ready for all the complaints about buses running late and everything. But kudos to you for doing this. You know, Ms. Miller's a huge advocate. I'm an advocate. The rest of the board are advocates for the program. More importantly, because of what you do, the specificity of students and the needs that you serve is much needed and long overdue for expansion. So thank you. But I think there's an opportunity for us to partner with you a little differently as well. So I'm excited. Look forward to having that conversation with you. Thank you.
100%.
All right. No further questions or comments. Thank you all very much. Thank you, Ms. Amato. Board members, the next item before you is the changes to the volunteer approval process. I have Jeanette Crowley, I have others here just in case there's additional questions. I provided you with an updated packet. It's before you. We did provide several attachments for the board to review. However, as you know, Frontier was down this morning, and we still are struggling with some intermittent outages. I know my desktop's not working right now. As a result, I will update this because there were some minor tweaks to this. Essentially, the talking points that I provided you is that due to recent changes in the legislature, we will have to amend our volunteer background screening process. They'll have to be moved to a level 2 background check. I apologize, I'm looking for my own copy of the talking points. They must be transitioned to a level 2 background check. The primary difference is fingerprinting, and this will now include an FBI background check and a national background check versus traditionally just done at the local level. So of significant concern is the increase in cost. It jumps from $40 for a background check to almost $100. It's $98 and some odd cents with processing fees and whatnot. The board historically has provided funding previously to offset that cost. So please understand, we have a little over 20,000 volunteers in Polk County Public Schools. Some of those are staff, some of those are law enforcement, some of those are individuals that are actually waived out of this process. They're exempt from this based off their current status, based off their current background checks and other factors. However, for the vast majority of those individuals, it will now more than double in cost. The school district historically has offset that cost by providing at least $15 per application. We typically budget right around $61,000, $62,000 a year to help offset that cost and keep it affordable for our families and our volunteers. One of the biggest concerns, we've talked about this before, when this was moving through the legislature, was the fact that that increased cost will absolutely price out some of our volunteers. What we are intending to do right now in order to ensure that we're compliant with this by the deadline of March 1st of 2025, effective December 20th, we will send a notification out to all of our current volunteers that any new applicant will also receive a similar correspondence that simply says that effective December 20th, we will no longer process renewals or new applications. The reasoning is effective March 1st, we must make that switch, that transition from the level 1 to level 2. It does not make any sense to charge someone to get their level 1 check to literally do this again for an additional cost just 3 or 4 months later. So we will use that time to communicate, develop processes, because again, the process of fingerprinting 20,000 individuals around March 1st to be in compliance is going to take a considerable amount of logistical effort. There are, at this time, approximately 1,500 registered sites in Polk County where individuals can go and be fingerprinted. But again, our biggest concern is the potential impact to the number of volunteers we currently have, because increasing it from $40 to almost $100 will absolutely price out some of our families. Please understand that this is required of all volunteers. This includes classroom parents that want to assist in the classroom. This includes field trip volunteers. Anyone who's going to be around our children must comply with this law change. So it will have a far-reaching impact on our school district and on our families and on our students. So again, I wanted to go ahead and make sure I brought this before you. You're not voting on anything anytime soon. You needed the background information. I needed you to be aware of the fact that we'll be sending that communication out, telling any new applicants, and again, any renewals, that we will not be accepting those at this time, effective December 20th. That message was slated to actually go out earlier than this meeting, but I asked the team, or respectfully I directed them, that no such communication would go out until after I had an opportunity to discuss this with the board publicly. This is not a Polk County initiative. Again, this is mandated by the legislature for very good reason. There's always been a legitimate and there's a growing concern that we may have individuals who are interacting with our students who should not be, that are inappropriate to be around children. And unfortunately, I don't think a day goes by that a case is not made somewhere in the nation that that's true. So we need to be very careful in ensuring that we're protecting our children and our families from potential predators or others. So the only concern I have, again, as I've expressed to you multiple times already here today, is the cost. I have serious concerns about that. What we can do, we'll be working with federal programs to come back to you. In order to meet the same expectation to keep the cost at the $40, or excuse me, at $25 for each individual applicant, we would have to budget nearly $350,000 versus the $61,000 that we currently budget. So again, I will identify potential funding sources for those, Title I, parental involvement, some other federal funds that we may be able to access. We'll be talking to our education foundation and also seeking private partners who may be willing to help us offset the costs associated with the background check for these individuals. So I'll open it up to any questions, but that's essentially, that summarizes the presentation or the content and the information I had to present to you here today. Mr. Sharpless.
Sure. I have a feeling I already know the answer to this question, but I'm going to ask anyhow. The superintendent. So an increased duty here, a mandate from the state. Are we seeing any increased funding for this?
You know the answer, sir. No, we're not seeing any increased funding for this.
Yeah, I'm all about keeping our kids safe, but it would be nice to have a little bit of funding to go along with this mandate.
And we can most assuredly continue to advocate for that. As we continue to advocate for increases in school safety funding, this could be a component of that.
Okay, thank you.
Ms. Fields.
My question was similar to Mr. Sharpless, and I really believe that we really need to pursue local funding, maybe at some of the local foundations, to see if there might be some resources there, because we're going to definitely have folks that can't afford to pay what's necessary. I understand the value of the level 2, but I also understand the value of people living from day to day and really wanting to be involved, parents coming wanting to volunteer at their child's school, and now there could be a barrier of them not. So,
well, I worry very similar to you, Ms. Fields, because this is the construct that I struggle with in my mind. We continue to promote parental rights and parental engagement. We beg our parents to be engaged and involved in our schools. And now every time they want to come on campus, every year that they want to do that, we're going to charge them $100. or every 5 years, excuse me. So to me, that just doesn't make any sense. These are their children, in particular for parents. I have some serious concerns about that. However, we also know that there may be people hidden within that population that we don't want around other children. I get that. And so we'll do the best we can. But yes, ma'am, we'll be working as aggressively as we can to help offset those costs. Yes, ma'am.
Thank you. I appreciate it.
Ms. Wyatt?
Thank you. I have a few questions, and I think several of us probably remember it's been 3 or 4 years ago now when we went to doing it every 5 years. One of the things that was talked about originally with level 2 was that there may be more opportunities. Once they're in your system, it comes up, if they're dinged in the FBI system, that we would get notified. If that is the case, are we still needing to do it every 5 years? And is that statute, or I thought that was something that we implemented, was the 5 years?
That's the requirement. I'll turn it over to Mr. Davis.
That is under statute, the 5 years?
Yes, and I want to give a little background on why this is now required, because there are some good things that's going to come from this. And first of all, to address the funding issue, no other school district helps offset that cost. So for other school districts, this wasn't a mandate on them. It is on our volunteers, though. So it does increase the cost on them to be able to volunteer. What has essentially happened, I believe we've talked about this when we presented some other policies, every time someone wants to volunteer with us or other agencies, state agencies, or even some nonprofits that work with vulnerable constituencies, they have to go through these background checks, but we didn't have a way of cross-checking them if they've already been screened for one. So if they want to volunteer at, Boys and Girls Club and then come volunteer for us, they had to have 2 separate background checks. Back in 2012, the state created a clearinghouse for those who work with vulnerable constituencies, mainly in the healthcare world. And that started collecting all these background checks. And then anyone that had a clearinghouse background check that worked for another agency that used the clearinghouse, they didn't have to be rescreened. They could just be cleared through the clearinghouse. So the legislature is now increasing the use of the clearinghouse, and they've mandated that the Department of Education start using the clearinghouse, which is why we're having to make this change. And that was done in 2023. The start date was supposed to be earlier this year, but it got bumped. So now we're looking at March because ACA, which controls clearinghouse, is not quite ready for us. So they're going to be ready by March. The good news is if they've already been cleared by the clearinghouse for another organization, they don't have to be re-cleared with us. And it is a 5-year renewal, so that will continue. That is the same for all of our employees. They'll have to start going through the clearinghouse, but they are on the renewal schedule. So if they just got hired by us and went through we already do essentially a level 2 for employees. They did modify a little bit. It used to be a list of offenses that if those popped up, if we flagged those, that we couldn't hire them. Well, that's been replaced by a level 2 statute. So it's a shift for employees, but we've already been screening them for basically a level 2. So those employees will not, when they get renewed, whenever their 5 years is up, then they'll be done through the clearinghouse. So really for our volunteers, we've not done a level 2. We've only done level 1 before. So that's why the cost is going up. But that's a little bit of the background of what's happening here and why it's happening. It wasn't just a mandate that they do level 2. It's that they go through the clearinghouse. And that's the hurdle we got to get over now. But once that's in place, it's going to actually, I think, work a little bit more efficiently for folks that happen to volunteer in other organizations.
I have a list. Sorry. So when we talked previously, if they are current volunteers, March 1st, they will have to have a level 2, or if they are current volunteers. So when are we starting the level 2 background checks? We can't do anything until March 1st?
No, that's not what I'm saying at all. It's the point of today was to make sure I provided you with the background information and I would receive any direction from you potentially by the January meeting as to any additional funding you want me to go ahead and see if we can allocate towards this cost to keep it more reasonable for our parents and our other volunteers. But based off that, we're already working on strategies to ensure, like I said, we've identified 1,500 certified sites where they can get their fingerprinting done. There are also mobile facilities that we may be able to utilize that we're currently in conversations with. And then that message on the 20th or before the 20th that will go out actually after this meeting, we'll notify them that we will not be renewing, and then we'll have subsequent follow-up information for them about how they can get it done, where to get it done. We will not be scheduling those. We will apprise them of those locations, their hours, those types of things. and then they'll have to go ahead and schedule those to get those done. Now, the mobile sites, if we do choose to utilize those, we may park those around the school district at various times, notify parents from that school in particular and say, hey, the volunteer fingerprinting bus will be there today or this evening or for the next 2 days. Please make sure you sign up and come out and get your fingerprints done. So there are options for us to ensure that as many of our volunteers can be done and prepared by the start of the next school year.
Okay, but what happens on March 1st?
On March 1st, anybody who's not in the system would no longer be allowed to volunteer in our schools.
But we're not getting access to the system till March 1st.
That's the ACA system.
So do they have to be in the ACA system to be able to volunteer on March 1st?
In accordance with the statute, they have to have a level 2 background check confirmed in order to volunteer. That information then has to be stored in that repository. But
So what are we doing my fear is that, I mean, how many sports do we have running in the month of March that if they can't get a background check in the new system until March 1st?
hence the reason we're sending out communications now.
But is it even possible for them to, so they can get can they get a level 2 background check in January, or can they not get it
Yes.
until March 1st because of the way?
No, they can get it done now and then apply it for March 1st. There's nothing prohibiting anyone from going out and getting a level 2 background check right now.
Actually, if I may speak to that, the only employees will be grandfathered if they have a level 2. On March 1st, it has to be through the clearinghouse. That's what the statute requires. The state, the Department of Education is aware of this. Other districts are aware of this. Miami-Dade has it even worse than we do, as you can imagine. We are working with them. We are hoping to get some grace. I'm sure there will be, they're going to have to work with us on this because of your questions. The Miami-Dade, they don't think they can have everybody in the system probably until end of summer. That's what if it's even possible. This is going to overwhelm the clearinghouse and the ACA staff. We already know that. So this is definitely something that's going to be a conversation going through Tallahassee and with the session. And that's really kind of out of our hands.
Is the deadline a DOE mandate or statute?
No,
the March 1st.
The March 1st is statute. Actually, the statute says January 1st, 2025, or at a later date as determined by ACA. And ACA has decided by March 1st they'll have this system ready to go.
So ACA is who would need to change it.
Yes, they would be the ones setting the deadline. This is, they can say this is when it kicks in, but I mean, you can't squeeze blood from a turnip. If you have volunteers that need to, or employees or anybody that needs to be able to continue to do their job, and you just made it available on March 1st, either we'll have a problem or they'll have to give us some space to work with that. Whether it be that, we start fingerprinting them then and they give us a month to get people fingerprinted, and then we can provisionally continue to use them until we get the results. I mean, I don't know how that's going to work. That's all logistics that we have to work out with Tallahassee.
I have 2 more questions. What is the turnaround time for a level 2 background check?
We don't know.
Okay, because I think that's an important question. Number 2 is, who do we need to advocate to be getting this pushed back to the end of summer? Because this is not, it just physically isn't going to, the way that it stands, we will not be able to have any volunteers in our schools the entire month of March at minimum.
I don't agree with that statement, but I would agree that to get 20,000 volunteers or even 50% of those volunteers fingerprinted and finalized would be very difficult. Yes, near impossible. However, there are other options for us, but at this time, to your first question, you need to advocate to your local representatives. We did not request this change. We did not petition for this request. We didn't lobby for it. At the end of the day, I see the value in it. My greatest concern is the timing, as I said, and more importantly, the cost associated with it. But at the end of the day, it's a mandate. Not much we can do at this point other than prepare for it. And if we can get an extension, then we will get an extension. Everyone's familiar with this situation because it's not just affecting volunteers. I think everybody needs to understand that there were changes to fingerprinting requirements, period, that were initiated or were mandated to take place this year as well. And they're moving from one system to another, and there have been frequent delays in that. Mr. Warren and his team have been involved in that because it does impact every single one of our current employees. And as a result, not only similar systems, but we don't understand why they're not migrating the data. These questions have been asked to the department. The department assured us, because as I spoke at FADS recently and this topic came up because this was a FADS topic that needed to be addressed with department staff, with the chancellor and with others, I expressed concern that it's not just about our staff, that each one of our school districts, Polk County, like I said, has over 20,000 registered volunteers, and we are a mid-sized large district when you think about who we run with in the Big Seven. So imagine how many volunteers Miami-Dade has to process. Imagine how many Broward has to process, and and Palm Beach. So all of those processing. That's why no one in here can answer or speculate as to how long it's going to take them to process a level 2 background check.
I
Because
just like if I were to go today,
correct.
would I get it in 2 weeks? Would I get it in a month? We don't know.
That's the problem. They get inundated cyclically with applications. And so when you think about the volume of additional in school districts and how many we're going to be pushing through the system, it's going to be complicated. So everyone's aware of that. We again sounded the alarm last week. I know Mr. Davis was in sessions and had conversations with individual. I know Mr. Warren and his team are in regular contact. There's a meeting with ACA that's taking place this week. So hopefully we'll get some further clarification there. And then again, the goal here is to try and put some steps and processes in place to get this done as expediently as we can for all of our volunteers, because the last thing we want to do is create barriers to volunteers coming onto our campus, especially parents. So
Can you get us a one-pager as soon as possible as we're talking to legislators, the statute number?
you have
who's
you have
ACA?
it. You have a 3-pager.
And that's not what was attached.
It was, but it was edited this morning.
Okay.
Further.
So there's.
So the statute number is in there as of this morning, and I'll update the attachment, but unfortunately the internet's
Okay.
down and I don't have the ability to do that.
Yeah. And then I had thoughts on moving forward, but I'm happy to, if you want to go to someone else and come.
Well, I'd like to be able to come back to you with options so that if we make a decision to help offset those costs, then we'll do so in a meaningful way. But Ms. Fields brought up something and you're touching on it as well, so I want to go ahead and address it here. There are some concerns among staff that other agencies will then direct their volunteers to come to Polk County to get their fingerprinting background check done at a reduced cost, and then they'll never essentially volunteer for us. That will be a stipulation, that if we offset your cost and you don't meet a certain number of volunteer hours within a specified period of time, we will seek reimbursement. That's going to be my recommendation to the board if we go down this path. As Mr. Davis said, we are one of a handful, if not probably one of 2 or 3 districts that offset the volunteer costs at all. But and we're going to ask Finn and others to provide us with some of that information for you. So you will see this again in January.
Okay. Thank you.
Ms. Miller.
I'll be quick. Promise. Someone who works with ACA, because I have to hire staff that goes through that background check. It can be, I've seen it done as quick as 10 days and seen it gone weeks. I cannot imagine that infrastructure is ready for this. I cannot imagine what will happen. And now I'm worried about the disability community who has to get their regular staff in place with the same system that's already struggling. So this will be much bigger. And I think my only, and I know we're going to talk about it as we move forward, but I think the messaging piece is important here, because not only parents, which we don't want to turn any parent away, but we have a lot of people that give their time in fine arts. We have a lot of people that give their time in athletics. We have people doing a lot, not just field trips. And we might need to talk about a scale or something, but I'm happy to talk about that later. But the messaging piece, people are where they are. They're on social media in their own space. And we can say this 100 times and we'll still get phone calls the day of a field trip because someone's not properly documented. So I think that's going to be part of the rollout, is how we message the update to parents. Thank you.
Dr. Allen?
Yeah, again, mine was a simple one as well, but I saw Mr. Warren come this way as well. So I was curious about, are we tracking like how many employees that this would be impacting that are sort of coming on the end of that 5-year renewal and so forth?
We're currently screening by the new criteria. We switched over for our new employees effective July 1. So we're good there on the on the new employees,
but
and our folks are in the renewal piece. Yeah. Our big concern, as you've already heard, is the volunteer piece, because they've been at a level 1, so this will be brand new. And we are working with this group of people that you see up and down the aisle. We're meeting every week to continually bring options, as Mr. Hyde has spoken about, that we can present to you for further consideration, as it specifically would apply to volunteers and the rolling schedule of those folks that may have come through, for example, Dan's area as a coach that may already be a level 2, and how that would all look and work as well. And we were mindful of the remarks of field trips and things going on in schools as well, as December and March encroaches on us. So we are looking at options that would allow schools to continue with those functions of having those volunteers attend those trips as well.
All right, thank you.
Seeing no further questions or comments, thank you very much. Next item is Miss Linda King, and it's a recommendation for changes to the ABCs of Diabetes program.
Thank you, Mr. Hyde, Dr. Allen, and School Board. Thank you for a chance to come before you again to talk about recommended changes to the ABCs of Diabetes program. With me today, I have Chris Whitney, who is the Health Center Manager with Marathon, and he's here to answer questions that you may have regarding more the program itself, as far as any things that I can address, because he's the medical side of things. So what we wanted to do, the ABCs of Diabetes program has been a volunteer program that we've had in place for employees to address their self-management of their behaviors surrounding their glucose management. And it's a very popular program. Currently, we have over 871, actually, employees as of the first part of the month that enrolled in the program. And when Dr. Agee came on board, she came on board earlier this past year, and she's the new head of the program at the health center. So we asked her to take a look at the program itself to see, because it had been some time since we had taken a look at that, and there had not been any changes to the program. And what she did is she took a look at that, and she had several comments and ideas to actually align it more with best practices surrounding diabetes management and also weight management. So she took a look at that, and she had several recommendations. Now, obviously, all the recommendations she had, we could not all adopt at the same time. So we took that before the Health Strategies Committee, and what we decided to adopt actually was, the first one was actually more surrounding a maintenance phase. Currently, everybody's on the same plateau. They never graduate from the program. And so what we decided to do, there are a lot of employees in the program that have a very well-controlled A1C, which is a measurement of your blood sugar over time. And their A1C is actually somewhere around 5 and 6 in most cases. And actually below 6, I think, is actually not even diabetic, I think. Under 6.4. Thank you, Chris. So in that case, actually what we decided to do is anybody that has a well-controlled, and she decided to put it at 7. And that would be consulting with their actual practitioner at the center. If it's well-controlled, then they would be put in this maintenance phase. And we looked at the group, and looking at their charts, we would determine that would be about half of these employees, or about 400 employees. Now, it's important for you to understand the main concern, I think, with the Health Strategies Committee and the people in general, don't take away my incentive. What if I fall off the ledge? I don't want to lose my supports, right? So we decided to take a look at that and say, okay, we'll still be here for you. Okay, you're still going to have all the support you need to stay in check. So you'll still have your zero copay should you need it for any of your medications, so you're not going to lose that, okay? And you also have the dietitian and the health coaching there if you need it, but the important thing is you will not be required to attend health coaching, and you won't be required to attend the dietitian regular support. What that does is it frees up those resources. Now, it's very important to understand that we really have a very large contingent of pre-diabetics. Now, looking at this number here, this is not all of our diabetics. We have a lot more that aren't even in the program. And our pre-diabetics, to be honest, is even larger. I don't even remember how high that number is, but it's concerning that we really can't even do much for them. We can do some programs for them, but we can't do a lot for them. So what this does is it frees up some of those resources to do other things for our employees. So we're excited about that. But at the same time, we're able to support them and feel like, you know what, you're doing great. So we'll give you a little bit of leash here, and we'll continue to monitor you. And if you need us, we're here. So you can still meet with the dietitian and the health coaching should you need to do that. All right, so this would be effective January 1 is when we would do that. Okay, so that would change January 1. And then we would also go back to, the intent of the program was always to only offer generic-only medications for controlling cholesterol and actually hypertension, okay? And for some reason, it was a combination of things, but I think for some reason employees were getting things other than generic, and that should never have happened because the program is only intended to offer generic-only medications. So we're going to make sure that that happens going forward with our new pharmacy benefit manager, Well Done. That's already been programmed. All right, and then the glucose management, and this is important for type 2 diabetics only. We're going to be changing to the Freestyle Libre glucose management program. And we had some time ago, we had Dexcom introduced as like a pilot program. This was probably about 5 years ago when I came on board with the school board. And so we had changed to Dexcom. Dexcom is about $2,000 per unit for the continuous glucose management for that particular device. And then it has sensors that read your glucose management. And so we had changed to those. They're about $2,000. And so what we're going to do is change now to the Freestyle Libre, which is only about $700. So we price those with Well Done. And they work about the same. In other words, you don't even need to hold it up to that. Now, there are some differences for type 1, I realize. I'm sorry, Beth. There are some differences. Yes, you are correct. So I do stand corrected on that, but this is just for type 2. Okay? And this would be effective for anyone new coming into the program January 1. So anyone new signs up that's type 2, they would start on the Freestyle, okay, in January 1. Okay, and then in April 1st, what we would do is anybody that runs out of sensors, as they use up sensors, they would change to the Freestyle if they're type 2, okay? And this is all, again, this is stuff we talked about with the Health Strategies Committee, and this is what they said they would like to do. This is their recommendations. Now, type 1, we would not do this, okay? Freestyle Libre does not work, does not communicate well with insulin pumps. So in most cases, we're going to have the Dexcom used for them because it will not communicate. The Freestyle will not communicate with insulin pumps, so we will have to stay on the Dexcom in most cases for them. And we have about 80 people that are type 1 that are in the program, okay? So beginning April 1, what we would do is we would, as people use up their sensors, we would change to the Freestyle Libre as those supplies are used up for the type 2s. And again, that's just looking at changing and going to a less expensive. The goal being to keep costs down, but also to keep the function there as well. Questions?
Ms. Miller?
Hi, good afternoon. Thank you. Apologize, I missed the very beginning, but I did have a couple of questions. First, I want you to confirm something. You just said out of the 870 plus members of this program, only 80 are type 1?
Yes. I believe so, yes.
Okay, that's interesting to me because that's a different outlook on long term. Not all of that's a different a lifelong illness compared to something that may not be. If we could help them remediate other things or help them be in control of that, options for them. And regarding options, when we're changing the equipment, are we giving the people that are using the equipment that will be phased out an option to receive discounted or purchased equipment, or if they want the one they have and it's going to change, they're going to have to go through without the program, receive it on their own through their insurance and the pharmacy? Is that how this will work?
What we're doing is this is what we're going to cover through the ABCs of Diabetes program. So this would be the option through that program for the $0.
So because I don't know. I haven't heard from many, but I know just people in general who use equipment kind of get used to what they're using, so it might be a difficult change for them. This program is $8.5 million. Is that what we came up with? With
That's about
800?
what we came, and that's pretty close. That's pretty much in the ballpark.
Is there a nut? And so we have 870 plus 71 members with a program with only 80 of those being type 1, where you're not going to reverse this illness. That's a huge investment into helping these people reverse this lifelong illness. Is there another program in our district that's a lifelong illness that is we invest in like this to help support? Or is it just diabetes?
It's just diabetes primarily right now.
Okay.
Yeah, that we're spending that kind of, it's a considerable amount of money.
It is considerable, yes.
Yes.
Okay, and I appreciate that you're giving this changes early enough for people to make their own choices in that. I think that's important. I think we need to be very cautious of the dollars spent. You're looking at $9,800 a person invested in this kind of program. And I know it's beneficial when people use it. I know people with type 1 diabetes, this is a program that helps them with cost. When we talk about the program, we talk about how we help graduate people out, and that's going to be what you're looking to do in the future instead of just remaining in the program.
Hopefully, one of the other recommendations that we weren't able to adopt yet because we just don't have the bandwidth within the centers was to see them more often, right, to help control. But we just don't have the bandwidth. So that wasn't something the Health Strategy Committee was ready to look at yet because we just don't have the ability to do that within the centers. So these are things that we'll, start looking at as we have the availability to look at those things.
And I love that we're offering this kind of support, but I also, the fiscal side of this, to keep spending these dollars on a set group of individuals who may or may not be participating fully in the program, we can no longer do that. We can't afford to do it. So I appreciate both committees looking at this and you presenting today. But I can tell you I'm shocked that I don't know why I haven't asked that question before, that only 80 out of 871 have a level of illness that we cannot, I for some reason I thought this was helping mainly type 1 diabetics.
Well, to be honest, it really, in my viewpoint, it really was only meant to be a behavior program, which really, I was shocked to see type 1 in it at all.
Okay.
Because to be honest, it was really meant to be a type 2 program,
right.
The one where you're driving behaviors. Because type 1 is like any other kind of autoimmune disease.
Right.
It's not something you can control. You either have it or you don't. So.
And there's other autoimmune diseases that
absolutely.
people
I have one. I
have lifelong cost,
yes.
And they're going to, and then it becomes an equitable situation. So thank you for sharing this information today. We've got to look forward to making changes in our programming, and I'm glad that we're doing it thoroughly. Thank you.
All right, you're welcome.
Ms. Fields?
I think that we need to go back and look at the history of the ABC of diabetes program. This has been in place for a long window of time, and the benefit that it has provided to our employees, and the seriousness of being a diabetic. I think everybody that deals with it, and even some that's not realizing that they're pre-diabetics, I think it's important for us to understand that. I wanted to have you to share with the board the concern that the committee had about communicating this change and how that's going to work and what that's going to look like for the people that's impacted by this.
Yes. Well, we're actually going to, it's going to be on one of the tiles on the Quantum website. It's already on there, up and running. So we'll be front and center on the Quantum site as far as the program itself. So the Quantum staff will be ready and available to talk about the program. I will tell you, as far as the people in the program compared to the people that are not in the program, have better outcomes and are more well controlled than the people that are out in the community, which is exactly what you want. If you are spending that kind of money, you want to make sure that they're doing better than people in the community. But as far as, I think the timing, if I remember right, Mrs. Fields, that's why we went April for that time to change, was to allow time for the people in the program to be allowed to phase in with the CGM, I think. Was that what you were referring to?
What I'm referring to, in addition to that, is the communication piece. How will the people know that they're going to be impacted by this?
Yes.
These changes are significant.
Yes.
And we wanted to make sure that it was communicated. If my memory serves me correctly, personal calls or some type of
With the health coaches reaching out to them.
given.
Yeah.
And that's what I want to make sure that it's understood. There's a lot of changes coming right now just with the health insurance in general.
Yes. The
And
health
we want to make
coaches.
sure that
Yeah.
our employees and our staff know what's going on. And I think that's the biggest thing for me anyway.
The health coaches, as I recall, are the ones that are going to be reaching out, talking to the members directly about these changes, because they are the ones that deal with these employees on a regular basis, because they are the ones dealing with them every month with the health coaching. So they are the ones that will be communicating the changes about the program. So, as I remember, am I not correct, Chris? Yeah. Thank you.
Ms. Wyatt?
Thank you. Is this something that has to be approved by the board?
Ultimately, yes.
When would that be coming for approval? Since this is our last meeting since January 1st when it's supposed to be implemented.
I believe it's coming, is it coming this evening?
It
I
doesn't.
thought we verified that yesterday. I thought I asked that. I'll have to check.
I didn't see it. I will tell you, I will not vote in support of this. This is now the fourth meeting that we've had a healthcare issue come before us that has not been presented in a timely manner before the insurance rolls out on June 1st or on January 1st. If we want to make changes to our health plan, that is great. I understand our fiduciary responsibility in doing that. But doing so after people had the opportunity to look at their health plan, whether they wanted to give more to an FSA, an HSA, whether they wanted to take their dependents and move them to their husband's or their wife's health insurance, whether they wanted to go to the marketplace to look for health insurance because what we're doing is no longer covered. It is inappropriate for us to be looking at making changes after that timeline has closed. So I will not be supporting anything that is done during this upcoming fiscal year because our people have already decided what they're doing for their health insurance, and it is not okay for us to go back and change what is being offered. And I feel like I say this every month, and maybe I need to get more intense about it because I do not understand why these presentations continue to come month after month for something to be implemented in this insurance year. I agree with Ms. Miller. It's interesting to me that only 80 are in the type 1 category. I think I've heard from half of them in the past 3 days that are very concerned about this change taking place. A couple of them have said, the worst thing that you can do for someone that's type 1 diabetic is change what their pump would be in the middle of the year. So I'm glad to hear that we won't be forcing them to change. I do have concerns a little bit that this could open up the floodgates for what does it look like down the road of are we going to at any point force them to change? But I also think that it sounds like there's cost associated beyond just the pump for type 2. That I don't know that we have gotten great information in the 2 paragraphs we got of what those additional costs are. I would love to see more information if the health strategies team got more information, but there is not enough data here for me to support this at all, but specifically in this timeline, there is no way.
Thank you.
Mr. Nolte?
Well, thank you for your hard work and time. I know you've put a lot of effort into this. I'm a diabetic, and I've been waiting over a month and a half for one of these little jobbers that goes on my arm. And I met with my doctor last week, and he prescribed a different one now. But I've been back and forth on the phone with him trying to come up with something. The one I had was fabulous because I could just look at my phone and see what it was, and then it stopped working. They thought it might have been a defective sensor, but it wasn't. The company apparently is redoing it. But because, when you prick your fingers 3 or 4 or 5 times a day, I'm sure glad I'm not a concert pianist. I'd have to go to one of our voc schools at night to get retrained to do something else. But anyway, do we have a backup plan so that if our employee has this sensor that I have and it's been backed up for a month and a half, that we have a quick plan? Because I would hate to see them having to do all their lesson plans and everything and having to prick their fingers every 3 or 4 hours. And
we have glucometers at the office that they can always come and utilize. Got plenty of them, got hundreds of them.
So it could be put into play quickly, because I wouldn't want them to see them go in a month and a half like I have. All right. Thank you.
Ms. Fields?
I want to go back to the comment that Ms. Wyatt made. We did have a very detailed presentation. I think the challenge has been is that we only had one meeting in November, one board meeting. Now, I don't remember when we had the meeting. If it might have been in November. But I am sure, I mean, it's not going to make a difference today with you as far as your vote. But I'm sure that Ms. King can provide every board member with the presentation. The PowerPoint, I mean, I don't have the PowerPoint, but I saw it. So they can maybe feel a little bit more comfortable. I'm sure that everybody understands transitioning from one health plan to another is that's a lot of work, and it is a big hurdle for us as a school district to contend with. But I think overall, and I would say the Health Strategy Committee, they worked extremely hard. This has been, what, 6 months, if not longer, that we've been working through this process. So I think we need a little bit of grace and just a little bit of mercy.
Ms. Wyatt?
And I don't want to diminish what the health strategies team has done. My concern is the timing of, we have already allowed people to elect what they're doing for their insurance this year, and then changing what the options are after they have selected it. So that is where I think that this is a great plan to look at implementing all of these things in 2026, but I can't support us doing it after we've already allowed our people to make their life decisions, because this affects people's lives drastically.
There are no further questions or comments.
Okay.
Thank you.
All right. Thank you.
I'll have to confirm. Okay.
It is not. So it can't be implemented in January 1st if we haven't approved it, correct?
I don't believe, I'll need to confirm.
Thank you.
The next item before the board is proposed rule development for school board policies. Teresa?
Good afternoon. We only have one policy today. It's like a Christmas present to you guys. It's policy 2421. It's the career and technical education policy. And this policy, there's a lot of bills and rule changes from the most recent legislative session that has been added to this policy. The first one is from Florida Rule 6A-1.09442, which just allows students to earn high school credit for participation in our career and technical student organizations. And then we also removed the requirement that the school board annually submit CTE curriculum to the Florida Department of Education, because this is not something that is the current statewide practice. This is just something that's been in the policy for years and years. That's something that's not done anymore. So Neola is just cleaning up policy, and it's not something that our district has done or that is done statewide. So it's just being that sentence from the policy is being removed. And then there were several House bills and Senate bills that address alternative options for holding a career fair, opportunities for middle school students related to career and professional academies. There's an additional waiver of tuition and fees for the GATE program. And then there's some ASVAB language in there for students in grades 11 and 12. All of that is from our most recent legislative session. And then the last change to this policy is a requirement for level 2 background screenings for adult students that are enrolled in post-secondary courses. Those are all the changes for this policy. I welcome any questions.
Dr. Allen?
Thank you, Superintendent. I think the one question I had was as it relates to the ASVAB. Have we been already offering the ASVAB? I mean, I thought that was a good change in this this policy in a sense as it relates to state statute, and was curious. Okay, moving forward, if this is now allowed or offered to 11th and 12th grade students, which in my opinion, I think should be earlier, especially as it relates to career technical potential for students, especially as it relates to our academies and the scaffolding of our academies. But just curious how procedurally you would foresee this one being rolled out as it relates to the ASVAB offerings for students. And is that data then shared with, like if the student takes the results and they were sharing it with their guidance counselor? I'm just curious, just in general, how you foresee, because our community's been asking for this for a long time as it relates to ASVAB as well, making sure that this is offered and so forth, right?
I've not had a single request about the ASVAB, so I'm not familiar with that aspect of it, but I can tell you that the scores are shared with students individually, and they'd have to share that with their school, for counseling purposes, but no, I mean, any student who takes it does get a score report specific to each one of the individualized areas, then they get a total comprehensive scoring report. And I didn't follow the second part of your question as far as,
Well, I was just wondering how you foresee implementing and communicating, make sure that this is accessible to families that would be interested in this for their student.
yeah, so typically it's taking your junior or your senior year, it depends. And then the students it's voluntary. So we would host it throughout the day. Students who have an interest, the school would then, it's typically done in the auditorium. However, right now it's probably computer-based, so it would probably be done in a media center or place or computer lab or a classroom setting, depending again on the size, number of students need to test, and the location. But those students would essentially sign up for it on the prescribed days and times. They'd have assigned periods in which they could complete it during the school day, which is far easier to do than to try and open up on a Saturday or Sunday or even in an evening to do that. But I'm sure some schools may want to accommodate that interest as well.
Yeah.
So parents would be made aware, much like our FAFSA meetings and other types of meetings, that's a possibility, that's an option for their child. I don't foresee mandating it for all of our students, but
Yeah. Yeah, I don't necessarily see it as a mandate,
Yeah.
but I mean, obviously, it's more so for recruiting as far as for the military.
Correct.
But I think the CTE outcome of that could be beneficial to a student in general. So,
I don't know. I'd have to do a little bit more research on it. I heard you say that, so I'll have to get with Miss Bennett to see if we can get some type of crosswalk for that assessment. And then I can bring that back to the board.
okay, thank you.
Yes, sir. I don't see any further questions.
Thank you.
The next item before the board is the proposed or draft of the PCPS legislative platform. Unfortunately, Ms. Dodge is not able to be with us today, but you do have the wonderful Mr. Davis here who helped summarize. I did provide the board with some summary responses that I provided to one of your colleagues based off questions they submitted about specific items, and I'll turn it over to Mr. Davis.
All right. If you have a copy of that before you that was attached to the agenda, I'm just going to walk you through it. For these items, Ms. Dodge and I have met with some of our staff, and we were going through a bunch of ideas, and she put together the ones that she's proposing on our platform this year. And we do have some staff here who might be able to provide additional information if you have questions about individual items. The first one, allow additional options to display proficiency in state standards and ensure all students calculated in school grade via alternative assessment are included in district grade. Eliminate charter schools who take the SIR rating from calculation of the district's grade. Next, we have hold school districts impacted by 2024 hurricanes harmless from loss of students due to displacement and consequences from late reporting submissions. And by the way, this is also on the FSBA platform, so we're kind of helping them with that lift, but that is a concern for our district. The third, eliminate state mandated school start times to allow local determination based on input from parents, families, and local community stakeholders. I'm sure you're very familiar with that law that passed a few years ago. That's going to mandate middle schools to start no earlier than 8 a.m. and high schools no earlier than 8:30 a.m. We did the community forums last year to get some input, and overwhelmingly what we got back was that those decisions should be made at the district level. So I believe FSBA is also going to be bringing this up, and we're going to be pushing pretty hard on that one. The fourth one, allow acceleration points to be included in the high school grades calculation formula for students graduating with the Florida Fine Arts Seal. If you may recall, last year we created the Florida Fine Arts Seal, that idea came to us from our own Fine Arts Director, Beth Cummings. Now, it's been brought to the legislature before, but she took it to Representative Jennifer Kennedy, who filed the bill, and it became law. So this is the continuation of that. It'll give a little more value to that seal. And the fifth, support and fund the development of high-quality in-person training for instructional leaders for the identification and remediation of dyscalculia. Excuse me. That's a learning disability for students who have trouble with numbers and math. And then we have some funding items we're going to work on. Support increases in mental health, ESE guaranteed, and transportation categoricals. Provide weighted VPK funding for students with disabilities to cover the additional costs of specialized teacher training in smaller specialized classrooms. Fund the High Growth Capital Outlay Fund. Continue funding increases of at least 5% and protect from proration for all students funded in the FEFP. Continue funding for the state academic tournament, which is $250,000, and support funding of $750,000 for a modular building to house East Polk Employee Health Clinic. So those are the items that she's put together for our platform, and we'll open it up now for your comments and input.
Ms. Fields?
Thank you. Just for the benefit of understanding the acronym, I would appreciate it going forward if we would spell the acronyms out. So SIR, can you, for the record, say what that is, please?
I actually cannot. I apologize.
That's okay.
It's the school improvement rating.
Okay.
Certain schools are able to opt in lieu of a school grade. They can take a school improvement rating. In fact, one of our presenters today showed their history of school improvement ratings. The unfortunate reality is the school improvement rating, while it does not provide a school grade, it does adversely impact, it could potentially impact a school district's overall performance. In this case, for us, it does. Hence the reason we've requested the removal of any charter school or any school that opts for a SIR rating to be removed from the district calculation. Does not mean that they won't be assessed, does not mean that they won't be held accountable for their performance, but we would like them to be removed from the district grade calculation simply because we don't have any influence or control over said school, and as a direct result, those outcomes, if they're not going to take a school grade, should not be allowed to adversely impact the school district's overall calculation performance. And in our case, it is absolutely true that in this case, it impacts our overall performance.
Thank you for clarifying that. For the
And we've also done the analysis across multiple other large districts, and we're trying to finalize that. There's only so much data we can analyze without their additional input, so that as we petition this, we can bring to our local legislators and representatives that this is not a Polk County issue alone, because it is absolutely not a Polk County issue. Please note that Polk County Public Schools does have schools that opt to take a SIR rating. We are not asking for them to be exempt from the school district calculation. We're simply saying those outside of the district, beyond our control, beyond our influence, beyond our impact, that those schools should not be included in the district calculation.
Thank you. And then my other question is, in reviewing what we currently have as our legislative platform for 2024, are there any areas in 2024 that's being carried over to 2025? Because I could not put my hands on the platform for 2024.
I'll have to get back with you on that. When I spoke with Ms. Dodge yesterday, she said you were looking for that, and I was able to find a copy of the 2024 platform, and I sent that to her by email. But I'll get back with you. We'll look into that and get you that answer.
Okay, and then the last thing that I have, I noticed the Florida School Board Association had attendance and accountability, and one of the areas that they have is to empower districts, we wouldn't say districts, to address chronic absenteeism by initiating intervention processes after 10 absences. I know absenteeism is a big issue for us. I know the superintendent has referenced it quite a bit. Did we have any discussion on maybe looking at that as a added area of concern? Superintendent Hyde, maybe you can.
I'm so sorry. I was just informed of a staff emergency.
That's
Could you
okay.
repeat your question?
Absenteeism. I know that we've been talking about the importance of that and the urgency of that, and the Florida School Board Association has that as one of their initiatives, but it's not on ours. Should that be? Is that something that we need to add to our platform?
We absolutely, if yes, there's no reason why we would not to be in alignment. The Florida School Boards Association, and I know that we had board members attending the recent combined conference sessions. It was a topic amongst the FADS superintendents as well. It is going to be a topic this year amongst the within legislative session. There's an interest. However, we've been told that the interest may be more so that districts aren't doing enough to address this issue, which is absolutely, in fact, patently false. Part of the issue is school districts can only do so much. Schools can only do so much. We do home visits, we hand placards, we make contact, we try to identify root issues of causation. But at the end of the day, with all due respect, we need better support from families and caregivers. And so any petition that we would take would be, how do we help engage families differently within the current mechanisms for this as well? So, but I know that this is going to be a sincere interest. So yes, ma'am, I don't see any issue with us including that in our overall legislative proposal. So we'll make note of that. And then we'll float another draft across the board. And so long as everyone's in agreement, then we can proceed with that.
Thank you.
Yes, ma'am. Dr. Allen?
Superintendent. Yeah, I mean, I was aware of the SIR rating, as it related to our earlier discussion today. If we don't get any traction on this, I mean, the fact that we're expanding, right, the seat capacity based on that conversation, does that have any bearing on us if we don't get any activity on that?
We're working very closely. As I mentioned earlier, one of the strategies we've talked about is incentivizing students to continue to remain engaged. And as students become overaged, their primary concern shifts from their educational attainment to income attainment, right? And so what we have hoped that we can do and what we're continuing to work towards is providing them access to our vocational trades programs through Travis and Ridge. And that as a direct result, should they continue to earn a C grade, perform, have good attendance, the way we would incentivize that is to allow them to participate in those programs, earn those industry certifications, and ultimately culminate in some type of career. I think that's a great strategy for us. I think it's a great initial starting place for us because much to their credit, there's a lot of truth. If a school like that were to close, those students are either going to come back to us or they're going to go into our community without a diploma, which makes them unfortunately subject to low wage employment options and other societal factors that would serve as barriers to their continued success and growth. So from our perspective, we want to continue to invest there. So potentially, would we see an increase? Could we see adverse impact to our overall graduation rate, things like that? The answer is yes, we could. The hope would be that over time, as we put these strategies in place, that we would help mitigate that. But
a couple more things. The data that was mentioned as well from the school start times and our DAC work. The town halls were great, by the way, around the school start times, very informational. Two things, could we get the data from the survey that was collected from all of our town hall meetings? And then secondly, could we get access to that presentation as well? And I did have some PR individuals from other counties that were asking how we were communicating that around our district. And they were pretty impressed with what we did with that with the town halls. So I'd like to be able to share that presentation and some of that data with other school districts. And just mentioned during our FSBA meeting this past week. Secondly, thank you for being here, Ms. Cummings, and your work on that. And we'll definitely be happy to support that initiative. Would be curious on what that would look like from your vision standpoint, because, right, if we look at all of our accelerated programs, we all have, each area has capstones, right? The AP capstone, the dual enrollment, early graduation, in a sense, which is a culmination. So I'm curious, what you're thinking as how we can advocate with our legislators and then across the state on this as well. Yes, for the seal, but are there like scaffolded opportunities in a sense that you see? Because what I think that FTE is like 0.16, when a student obtains the industry-based certification and so forth, and then working their way upwards. Do you see any opportunities to scaffold, or is it just a one thing? If you obtain the seal, this accelerated option would come back to the district.
So thank you for your question and thank you for your support. The Fine Arts Seal is a very rigorous process that the students have to go through to obtain the seal. The difference between the seal and then a capstone, an industry certification exam, is that it is a process over their 4-year high school career. We are tracking all of that information now. We'll have all kinds of wonderful data for you in the spring here once we get those finished. As far as the legislation goes, the way we were looking at it, it would fall in line with it would not particularly have a scaffolding portion to it. It would be, if you obtain that, then it would go into the numerator, denominator thing to do the acceleration points in there. So it falls into the same thing as taking an ASVAB exam that came up a few minutes ago, or some of those other acceleration points.
Okay, great. Thank you.
Thank you.
Mr. Sharpless?
Sure. So my question is going back to the school improvement rating. I understand why we want to, potentially advocate for schools that we don't control. Like, we're authorizers for these charter schools. We're not in the implementation of their day-to-day processes, right? So my question is, why not advocate for not just a school improvement rating, but they're also their grades to impact our grades, completely take them out of the equation. We're not operating those schools, so why it's just me trying to think in a more systematic way. Why not remove their impact on our school grade, our district grade altogether?
So more so with a school, so there's several ways to answer that. And I'll start with the ones that are less controversial. We have more management and more ability to address a low-performing charter school that takes a traditional letter grade.
Okay.
Simply stated. I believe in the integrity of the school accountability and grading system. And so if we're going to be graded in one of our charter schools that we authorize, and ultimately we are the authorizer, which puts us in a position that we should be managing from the perspective of holding a charter school accountable, as the statute allows, for fiscal responsibility, academic attainment, proper leadership, those types of things. There are very limited criterion in which a school district can revoke or seek corrective action from a charter school, as outlined in statute. But I believe in the accountability system. So if they're taking a grade, I don't see the impact overall to our school district, because should that grade decline to a point where the board and my office have concerns, we have a mechanism to address that. The SIR rating is very ambiguous. I do believe it lies outside of the school grading system, and as a result should be on its own. Again, we're not asking for that school not to be assessed and held accountable for their performance. Just do it outside of the district calculation, is what we're advocating for. The most controversial answer I can give you is that I do believe that a petition and lobbying to do so, as you requested, is a bridge too far for our legislature. That topic has come up repeatedly. Why not put charter schools on their own grading mechanism, for many of the same reasons that I've cited here today? But that has not been received well. And so, again, I'm looking at just this specific instance. How do we best represent? Because as I've shared with you before, if we were to take out those charter schools that accept a SIR rating from our district calculation, our graduation rate increases significantly, and our overall total percentage of points attainment, we would be a B district right now. We're 1/10 of a point away. So at the end of the day, we would be a B-rated district right now. And so considering, again, the fact that we don't have day-to-day influence control, they operate with autonomy, those types of things, which they're empowered to do and allowed to do under within the statute. At the end of the day, we should be graded based off our performance, is my position. So I know I gave you several answers there, and it's a package deal. But again, I think that politically, the landscape would not support us to petition the complete removal of charter schools from our grading calculation, because you could make an argument, and I think, I'm not going to drag Mr. Murphy into this, but I think from a legal perspective, if we need additional guidance and information, he would agree. The statute affords us a better mechanism to address low-performing charters that accept a school performance letter grade than they do the SIR rating. So
I think that's the key, what you just said. I appreciate that detailed answer. Thank you.
yes, sir. You're welcome. Ms. Wyatt?
Thank you. One of the items, and I know you mentioned it briefly in your weekly report, was the modular building. Is there a reason for us to, or do we specifically want a modular building? Is there a reason for us to call it that on the?
I think it's because that's what we had, and it's probably the cheapest mechanism for construction. But you and other colleagues, some of your fellow board members have all raised the concern, does it have to be modular? No, it doesn't. I think what we would do is do the cost analysis to determine what would be the best possible solution for us. I would say that putting an employee clinic next to a restaurant, where we have frequent issues with drainage and clogs and grease traps, probably wasn't the best location. So we would have to be a little bit more aggressive in pursuing expansion and relocation for those clinics.
Would it make sense for us to just say support funding of $750,000 for a building to house East Polk, or for facilities?
Yeah,
Maybe for facilities.
I know Linda's there, but I don't think there's any, or Heather, is there a reason that it stipulates modular versus a traditional capital expenditure? I'm sorry, Miss Jenkins, not Heather.
I just think if we can put facilities instead, then it could go either way, and it's not.
No, sir, it's just 750,000 wouldn't be enough to support a building. These are a little bit different that we've looked into. They're a little bit more permanent. They've used them in a couple different districts, and the modular, for your consideration, would allow us to have more locations. So Ms. Dodge was going to look into seeing if she could ask for multiple funding. We're providing her with a heat map of where our employees are located. So that was a development later at the end of the week, but I can talk with her about changing it.
Okay, if we would be okay with it being multiple things, then I don't want to not be able to use the funding on facilities.
Requests for expansion of our employee clinics.
Yes, sir.
Awesome. Thank you.
Ms. Miller?
I'm just going to say 35 questions came from me. I apologize. And not really, I don't apologize. But that was one of my questions about modular, only because I would rather it be a broad statement than reading that, because I had to ask for clarification, and that means anybody else reading that, even as a public document, would think that I'm putting up one of our portables out there to put a health clinic in. So I think it's better to change the wording. I support changing that. Thank you.
Ms. Wyatt?
Sorry, I did have one more question I forgot. So not specifically related to any of the items on our legislative priorities, but I know previously Ms. Dodge met with several of our other community partners, chambers, EDCs, some of the business community, to go over our platform so that they understood it. Is that something that she still does, or is that something that's now under you all? I just want to make sure that doesn't get dropped in transition, because I know that is a huge asset, is having business partners that can go in when they're meeting with legislators and explain why school start times are really a bad idea for Publix.
Primarily, that's why we continue to employ Ms. Dodge in her present capacity, is to serve as our lobbyist in that role. But Mr. Davis, Teresa, myself, and others are frequently asked to attend those when they're scheduled. So that the first starting place is here to get an effective draft, and then we can start meeting, because there's some additional background information on each of these that I would provide you, right? So one of the questions that hasn't been asked today but was asked, and I provided a response in writing, was item number 3 in the bottom section under funding the high growth capital outlay fund. It seems like a silly ask, but while that fund exists, it's never funded. It's never allocated funds in the general appropriation. And the statute itself that allows for that funding, the very first line stipulates that the funding will be made available if allocated. So as a school district that meets all of the criterion to qualify for that, we would love to be able to advocate and see that it's funded. So that's another one. So there's a lot of background information to some of these. And again, I appreciate the questions that Ms. Miller and others, yourself and others, have submitted, Mr. Sharpless, to my office to say, hey, can you clarify this for me? because I appreciate your due diligence, but there would be background information on each of these so that you have talking points and you have that full understanding should you be speaking to someone in the community, local leadership, or even state, national leadership as well.
And we're going to get a one-pager, nice booklet like we have before with all of it.
I will try. I will try.
Thank you.
Some of these may require a little bit more, but I may give you supplemental information.
I mean, more because we used to get a pamphlet that we can share with the community.
Yes.
So those will have.
That you'll have.
Okay.
Yes, ma'am.
Perfect. Thank you.
Yes, ma'am. Sir Davis, anything else that I may have missed?
No, this is the input we were looking for. Thank you.
Okay. I see no further questions or comments. Board members and guests, we are going to go ahead and take a short 15-minute break. That will allow the IT team enough time to load the next presentation, allow you to take care of a few things, and then we'll come back. We have had intermittent internet come back and forth connectivity. Mine's still down, but if you keep hitting your refresh, you might be able to see, you might see it pop up. But if not, if it does come back online and it is uninterrupted for a specific period of time, I may ask for another short recess again so that we can go ahead and get everybody rebooted and back online. So, but I'll keep you in a loop on that. Thank you.
I think it's an easy fix, and it's a cost neutral fix. It's very soft. Oh. Sorry.
Welcome back. At this time, I would like to call this meeting back to order and turn it over to Superintendent Hyde to finish off leading our work session today. Superintendent?
Sir, Mr. Chair, members of the board, members of community staff, at this time, it's my pleasure to bring forward Ms. Heather Jenkins and Mr. Brian Warren. Unfortunately, Mr. Pitts had to leave, and I'll provide an explanation to the board later to deal with a family matter, but these two will be more than happy to summarize and provide an overview and review of the staffing changes that are being proposed.
Regarding ASME, relative to those raises. And we are very pleased to present to you today that we have a collaborative tentative salary agreement that has been approved by both groups. I was notified by Marjorie yesterday that both of those had gone through. Those two groups represent custodial maintenance, EARS, which is electronic equipment repair and support services, as well as vehicle services and warehouse employees, and also school nutrition assistants. We came together in a session on November 14th. We spent several hours together in and out of caucus and came to agreement on what you see before you. The ASME group that you will be voting on this evening represents Local 2227, and they represent approximately 1,760 employees under the Custodial Maintenance and Vehicle Services and School Nutrition Assistant Collective Bargaining Agreement. In summary, you have 963 custodial and EARS employees, also including vehicle services and warehouse employees, and over 797 school nutrition assistants. Following school board approval, the attached tentative salary increases that you have before you will be retroed back to July 1 for those individuals. And we are excited about that. We also want to make notice and remind everyone that we were pleased that looking back, October 22nd of 24, you also approved and ratified the 24-25 salary settlement for bus drivers and bus attendants, similarly retroactive back to July 1 as well. To summarize the substantive revisions in those agreements, for custodial, we call them EARS, which is electronic equipment repair and support folks, maintenance, trades, vehicle services, and warehouse employees. The day custodian starting wage will increase from $15.15 to $15.72 per hour. Maintenance and trades, warehouse workers are going to see a salary increase in the range of 3.5% to 5.25%, depending on the position and the salary level. We're also pleased with school nutrition assistants that the starting hourly rate will increase from $15.25 to $15.78 per hour. And our most experienced employees at the top of the 24-25 salary level will see an increase of 6.5%, earning $18.37 per hour. That is coming at a financial impact of $2,335,432. And I want to also offer that because of the way the schedules were negotiated relative to what we refer to as enhancing those schedules by certain percentages for those grids that you have there before you, that is going to allow us to provide these monies retroactive to July 1 for these employees in their January pay. So I'm happy to take any questions that you may have regarding those ASME pieces at this time. right?
Dr. Allen?
Yeah, thank you, Superintendent. I was just curious, so we're going to have someone that's going to be with us tonight to share the executive summary during our action item when we vote on that.
Or ask me?
Yep.
Mr. Warren and his team will still be here.
Okay, great. Thank you. I would love to. Yep,
I'm sorry, there were two executive summaries on this portion, so I wasn't sure.
correct.
We were talking about the
Yep.
reorg. Okay.
And I was summarizing for you the one that you already have loaded up for board meeting as well.
Okay, great. Thank you.
All right. Any other questions?
Seeing none. Thank you, sir.
If it's in order, the next summary that I would like to move to is a summary of the non-union salary increase summary. We refer to this as our NUG group. It's our non-union group. This group represents over 1,106 employees. We refer to them also as our professional technical folks. And it will also extend over into our school-based admin group as well. So similarly to the summary that we just provided for our ASME group, this group, effective July 1, 2024, will receive 4% increase to their salary levels as well. So effective July 1, 2024, all non-union salary scales and school administrator salary scales are going to increase by a straight 4%. We will not provide any level movement because that helps facilitate the implementation and the payment of those folks. Because similarly, as we summarize for ASME, for this group as well, we'll be able to provide those increases in their January pay, looking back retroactively to July 1. The cost of this increase of enhancing this salary schedule is $3,273,222. And I believe by my notes here, those new salary scales, we were having technical difficulties this morning, should be attached to that item as well for your review and consideration.
Mr. Sharpless.
So I just want to be clear, 4% for the NUG group total, and remind me again for ASME, is it 4% as well? Okay.
It is not, it would be 4% overall is where we started. If we reflect back on the original discussions for where we started negotiations relative to the amounts of money provided to groups based on the number of employees, in negotiations with ASME, they elected various options based on level that would extend, like I said, 3.5% to 5.5%, depending on level or experience. So it's not all 4% for ASME. I don't want that to be.
But for the NUG group,
For the
every
NUG group,
person, regardless of whatever, everyone's getting 4%?
that is correct. For NUG, it is 4% for everybody.
Okay.
And not so for ASME. So that would be specific by level.
Okay. So is there any discussions based on, certain employees' salary schedule versus others on, percentage of increase there? I mean, or is it just why, I guess my question is why the flat 4% over all those NUG employees rather than in different groups? Was there any discussions on that?
I think that was an evaluation of just maybe equity and not creating disparity. When we go into those sheets that you see attached, we focus on the distance or the money between each of those levels. So we try to keep those similarly oriented. And so we like to keep them straight across the board. So when we do talk about increasing levels, it's easier for budget for that or otherwise.
Also, Mr. Sharpless, due to our SAP upgrade and our limitations in making level adjustments at this time, because of the work that we're doing, we kept it across the board at a percentage. And independent of our increases, we are doing reviews of different job descriptions, salary levels. That's an ongoing thing that we do with HR and also our unions as the years go on. So, as Mr. Warren said, it is an equity piece for the 4%.
Ms. Miller?
I have a question. I don't have it all in front of me here. But in talking about groups, when you talk about leadership and principals at our schools, I know we've talked in the past, and I've talked to the superintendent about how it's changed over the years when we took away, ways for them to earn money based on the demographics of their school number-wise and what they were doing. There's a big disparity, and especially in my region, there's a big disparity in some of our leadership salaries. I know we were going back to look at that. Can you tell me the progress that's been made in that? Because as we all know, as the referendums have gone on around the county, we have some really good leaders here that need to be compensated so we don't lose them, and because of the work they're doing. Nobody was here, I don't think, that was around when things got changed, and I think people at the time, they had to make some tough choices, and with the intent of bringing some of those options back to the salary schedule, but they were never brought back. And so when I pulled that, I was interested in when we're going to address that equitably.
We continue to discuss, and the 4% allows us to provide the equitable piece to get money into their hands relative to the raise. And we continue to review the differentiated pay options that would be specific to the priorities that we see, whether it be by size of school, level of school, Title I, top. There's a myriad of things that's in consideration or evaluation. So we're continuing to be in negotiations or in talks of how that would look. But we didn't want to wait on the 4% as well as the other pieces that are going to be laid on top of this as well. So we wanted to bring the 4% out, and we have informed administrators that we are continuing to review those additional monies that would come by way of the methodologies I just summarized.
I appreciate that. We talked about this last year, and we were talking about looking at it in July. So I need a timeline of when we can tell these people that we're looking at the differentiated pay. I appreciate we didn't wait on the 4%. Right. But is it going to be mid-year 2025?
They have that information. So we work with ASBA on this. This is not done in isolation. This is an ongoing discussion. They meet with them as frequently as ASBA meets with me in HR to continue to have a dialogue about potential changes. They're not a voting group. It's not a union group, but we do that as a courtesy. And we have to continue to evaluate the overall impact on their financial status to do that, but it would be differentiated pay. There are some schools that are far more difficult to address through differentiated pay than others. For example, some of our center schools. I don't think anyone would argue that there shouldn't be a way to come up with a way to provide some additional compensation to those building leaders based off the students and the clientele that they serve each day. However, in a traditional differentiated pay mechanism or scale, they would ordinarily not qualify for changes. In all likelihood, as we've discussed, it will probably be a level change for those administrators. Instead of being funded or on the elementary principal salary schedule, they may be moved to the secondary principal salary schedule. So this is an ongoing topic, but it is done separate from traditional raises because it's going to have to address the salary schedule, and it's considered additional compensation. It's not part of their initial or origin compensation structure.
Yeah, I appreciate that. I wasn't even considering center schools. We have high schools that are very different in pay scales. So, and it's kind of a long-term problem that it's going to take a while to fix. I just need to see the light. So can you update the board on when those decisions are made or timelines for those decisions when they come back up? Because I know we've been talking about it for at least a year.
We'll review those priorities and work on getting a timeline of that progression of where we will be.
Okay. Thank you.
There are no further questions on that topic.
As promised, Mr. Pitts has provided you all with a spreadsheet discussing our district reorg. It's taken a while for us to get this put together for you. But as you know, with our upcoming, we talk a lot about our SAP upgrade. So we've been very intentional in reviewing these changes for the positions that will help support the district during that upgrade. If it's the board's will, I'm going to go through and read the summary. We also have the spreadsheet up if you have any questions as we go through, or we can wait until I finish. So on chart 3, Office of the Superintendent, for Equity and Diversity, we have Fund 1 Senior Analyst, Equity and Investigator. This additional position is needed to effectively handle the EEOC cases for the district, as the district has seen an increase in the number of cases filed. I do have one question. There are several of these. Would you prefer I read the description to you as we go through, or how would you all like to do this? To you.
I would just go through the summary. That's typically how we've gone through it. So just go ahead and go through each one, allow the board members to ask questions as we go. So I'll keep monitoring the speakers list.
Okay, thank you, sir. Fund 1 Senior Analyst, Supplier Diversity. Upgrade 1 Analyst, Equity and Compliance to Senior Coordinator, Equity and Compliance. Under the Polk Education Foundation, fund 0.5 of a manager, scholarships from part-time to full-time. It's currently a part-time position. Public Relations and Strategic Partnerships, upgrade 1 Senior Coordinator to Assistant Director of Creative Communications. Within the Deputy Superintendent's Office, Assistant Superintendent of Support Services, Transportation and Support Services. Fund 10 bus drivers, special needs transportation. Fund 10 bus attendants to accompany those drivers. Upgrade 1 specialist training to senior coordinator of training. Upgrade 4 specialists, safety, to analysts of safety. Upgrade 9 technicians, routing, to specialists of routing. Fund 1 Director of Support Services Liaison. A lot of the transportation positions are to expand our growing need. Assistant Superintendent of Support Services, School Nutrition and Warehousing. Upgrade a Maintenance and Materials Specialist. Upgrade a Central Warehouse to Supervisor Warehouse. Fund 1 Warehouse Supervisor. Upgrade a Director of School Nutrition to the Senior Director of School Nutrition. Fund a School Nutrition Specialist. Fund a School Nutrition Coordinator. Fund a School Nutrition Supervisor. Fund a School Nutrition Senior Technician. Teaching and Learning, Chief Academic Office, Office of Acceleration and Innovation. Upgrade a TRST to a Senior Coordinator of College and Career. Upgrade a TRST to Senior Coordinator, School Counseling, Education and Literacy. Educational Systems and Foundational Learning. Fund the Office Systems Specialist. This position is funded by Head Start. Professional Development. Change funding of the full release mentors from ESSER funding to Title II. They were previously funded from ESSER dollars. Change funding of a senior coordinator for coaching and mentoring from ESSER to Title II. Fund 6 full release mentors. That would be funded from Title II. And fund a senior coordinator of coaching and mentoring with Title II. Business services under the Chief Financial Officer, Federal Programs and Grant Management. Change 5 teacher interventionists, title only, to migrant advocate. This is a title only change to better describe their job duties. Fund 1 senior coordinator, internal audit and subrecipient monitoring. This will be funded with Title I and UNISIG. Upgrade a senior technician of grants to an analyst of grants. Unfund a federal program technician. Fund 1 specialist federal programs. Under the Assistant Superintendent of Facilities and Operations, Architectural Planning and Maintenance, upgrade a fire inspector to a senior coordinator of fire and safety. Fund 1 senior coordinator building official. This position is currently contracted. Excuse me. Fund an analyst of planning. Fund 1 assistant director GIS demographer. Fund assistant director of real estate. Upgrade 5 managers, custodial managers. Under the Associate Superintendent, Chief Financial Officer, Budget and Accounting, Upgrade one senior manager of staffing to a director of school budget and staffing. Upgrade one analyst budget to a coordinator of budget. This next item says fund one analyst of budget. It would actually be two. There's one over elementary, one over secondary. We'll make that correction. Upgrade one senior technician of staffing to an analyst. And upgrade a senior technician of accounting to an accounting analyst. All of those changes within budget support our new site-based budgeting model. All of the schools will be on site-based next year, so we're creating a structure to better support the schools. Purchasing and printing, unfund one clerk specialist. Upgrade one manager of competitive solicitations to a senior manager of competitive solicitations. Upgrade one manager purchasing services to a senior manager of purchasing services. Upgrade the print shop manager to a senior manager. Upgrade two senior technicians in purchasing, which are buyers, to analysts. Upgrade two supervisors of purchasing, which are also buyers, to senior analysts. Upgrade a senior technician purchasing buyer to a coordinator. Upgrade one senior technician of purchasing to an administrator of purchase cards. Benefits and risk management. Fund one director of benefits. Fund one coordinator of benefits. Fund one coordinator for leave management. Upgrade one senior manager of risk to a director of risk management. Associate superintendent in human resource services. Unfund one clerk. Unfund one specialist. Upgrade one senior manager to a director of classification and compensation. Upgrade two technicians to call center specialists. Upgrade two specialists to coordinators of personnel. Upgrade two analysts to senior analysts of classification and compensation. And we have reached the end. Within this presentation, you'll see, you've heard me say the word upgrade several times. What we have done is we've looked at the duties of these jobs. They have not changed the duties have changed over many, many years. However, the job descriptions have not. And many of these positions will have to take on additional duties so that the directors and senior directors can assist as we create documentation and prepare for the upgrade. As we upgrade SAP, a lot of our processes will change. We need to document what we have and make key decisions to help streamline and prepare for the next 20 years of our computer system. Do you have any questions?
Mr. Sharpless.
I would love to have lots of questions, but was this the document that was sent to us last night? Emailed? I haven't been able to. Yes, from Mr. Pitts. Okay, I haven't been able to review this yet. It's kind of frustrating. I'm just going to tell you, and I know that didn't come from you, but it's frustrating that, and I know we're not voting on this this month, but I would like to have questions. So I'm not going to be able to have any questions except for one today because I didn't receive it till last night. So my one question is, if you took all these changes, what is our price tag on all of this? Because I'm not looking through all these stacks of
Total, for the general fund, it's $2.8 million. Total for everything we've brought to you from July until this point. What is included in this packet is a little over $1 million. So the grand total is $4 million.
Okay, thank you.
Yes, sir.
Mr. Nolte?
Did you look at my questions I had written down?
I did not.
I had the exact same questions. You know, I'm old, retired, 36 years classroom teacher. I was just curious to see how these numbers worked out because I didn't really look at them as thoroughly as I'd like to. But thank you for your hard work and thank you for your answers.
You're welcome.
Thank you.
Ms. Fields?
My concern is the same as Mr. Sharpless. Something as intense and as expensive as this, I think we should have definitely had more time to chew on it. And the other question that I have is, I looked in the binder and maybe my mom will look at it, but is there an organizational chart for all of these positions? I see where it's listed by position and the costs and the units and stuff, but do we have an organizational chart so we can see exactly what every department looks like as it relates to these upgrades and these additional positions?
I'll get that to you, Mrs. Fields. We'll get it together. There is one with our issues today and previously. I'll find out and we'll get it.
I think those were my concerns. Thank you.
So I'm going to ask the question because several of you have now brought it up. The board won't even vote on this for another month and a half. So with all due respect, how much time do you think you need? You received the documents last night. The intent of the workshop is to provide a presentation. You will have 2 subsequent workshops to ask as many questions as you'd like. So I don't know what the expectation is, and I realize there may be frustrations from time to time with attachments not being on there timely, and that's an issue that you need to direct to me, and I will address that, as some of you have. But I don't think it's a fair criticism to say, well, I received this last night, when you're not being asked to address this for another 3 meetings, as was clearly noted in the email that was sent last night. So I'm asking for clarification with all due respect, because I'll leave it at that.
Well, can I answer? Yeah. Since I was one of the ones that said it. First of all, Superintendent Hyde, I didn't see the email last night. Okay, that's the first thing. And then the other thing is that while we have, you're right, adequate enough time, some of us, and primarily for me, if I'm looking at it, I might want to see what the organizational chart looks like. And maybe it needs to be understood that when stuff like this come a month and a half in advance, then it is primarily for us to just swallow. And then as we go through the process, then we can chew on it and get the additional information. I don't mean any disrespect to anyone on your staff, nor to you. However, in the past, it used to be nothing would go on the agenda without attachments. But now, things go on the agenda without attachment. And in the past, board members sitting here, some of them would give the superintendent have it because it wasn't on there. But now we get a lot of things and we don't get it until last minute. So I think that's my concern.
And I will address that, as I have.
Yes, sir.
Yes, ma'am.
I can only speak.
I have my.
Ms. Wyatt?
Thank you. I think the confusion comes in. We've done this several ways over the past several years that often it has happened, and it's happened both ways. Sometimes it comes to us and it's, hey, we need to bring this back to back. And we don't get, so I think if we were going to get it last night, I don't necessarily know that having it on the agenda today was necessary, because as beautifully as you read the entire document, I think it's a waste of time to have it on the agenda today when we don't really have we haven't been able to do our homework to ask the questions. So having it 2 weeks before our meeting in January is very helpful, but I don't know that we needed to go over it today to just hear Ms. Jenkins read.
Well, I mean, and I hear that, but I'll disagree because of what Ms. Fields just said, or what Mr. Sharpless mentioned earlier. If the org chart, if there's a question that I'd like to see the org chart that goes along with this that shows the changes, then over the course of the next 2 meetings, I need to make sure I have that, right? It doesn't make sense to wait to the next meeting to hear that yet again. And so what we've tried to do, and this unfortunately has been delayed several times, in part now because of raises and other things, because all the numbers change anytime you go in to start changing salaries and benefits and things of that nature. So all of that has to be evaluated. And this is a very abbreviated list compared to what was initially submitted that we went through and then rank prioritized, because as you note, as we've gone through this, and the board started with the reorg actually during the summer of this year. You approved phase 1. We then brought a subsequent phase. Board received additional messaging as recently as November, and then we pulled the item because there were some concerns with, again, raises and the implications. We didn't want to misrepresent what the total cost would be to the district moving forward. So, what I've tried to do here with respect to the concern about the attachments, absolutely hear you loud and clear. Our expectation is once I meet with the chair and the board meeting is approved, by the Thursday, all attachments need to be submitted of that week. So that gives you plenty of time to be able to read through materials and be prepared to have a subsequent conversation. That did not occur. I was not copied on last night's email. I was not aware of last night's email until one of the board members forwarded it to me last night. And so I will address that, and I have already addressed that with the individual involved. But again, looking at the timeline that's being provided, it is a more than adequate timeline. And this should be a conversation that takes multiple meetings from my perspective. So I hear what the board is saying, but I think that today, maybe reading the entirety of the position changes was not beneficial. And you've seen me pause that in the past, saying, no, let's just see if there's any specific ones that the board may have questions about. But at least we got to some of the concerns that we're dealing with right now, right? The timeliness of postings and ensuring that the board has the documents they need to do your due diligence. You're the elected officials. You're the ones that derive my work. You make the decisions. You set policy. You set goals and objectives. So at the end of the day, you need to have that information to be able to do that. I hear you loud and clear. But in this case, knowing that there's 6 weeks before the board's going to be expected to vote on it, I think it's an appropriate timeline. But if we need to modify that further, but I think to Ms. Wyatt's point, we need to make sure that the information that you provided leads to the next conversation rather than teeing it up the way maybe we did it today. So I completely understand that. So
And this will be on the agenda in the January.
the next 2 agendas. Yes, ma'am.
Thank you.
It will be on the workshop agenda.
The 14th.
Yes, ma'am. And then it'll be on workshop in the subsequent meeting in January, and then at the board meeting for a vote that night.
Thank you.
Yes, ma'am. Mr. Sharpless.
My frustration is when I'm hearing it really for the first time here. I'm trying to process everything and try to think of questions, and it's really hard to do that when you have a whole, how many pages worth of things here? So it's not, maybe we shouldn't have done it the way we did it today. That's what I'm trying to say.
Sure.
Okay. It's not that it's not that we don't have adequate time to ask questions in subsequent meetings. It just felt really rushed today in trying to soak in all that information.
Thank you for that.
You're welcome.
Mr. Nolte?
And I did not realize the timeline. I figured I must have missed something, but I don't want to get anybody's blood pressure up, but I definitely would not have asked the question if I knew we had several more work sessions to talk about it. So thank you.
Dr. Allen?
Yeah, I think when the email, this is my opinion, when it came through last night, I hit forward, but I didn't click to send to you. But my one response was, why am I receiving this at 8:23 p.m.? So it was frustrating for me. And I'm like, I'm sitting, I've got work I'm doing. I don't have time to break away at that time of the night to work through it. Maybe we should have put it under informational items because it was just very linear. At this point, I don't think anybody had any substantive question on it. I think, to address Mr. Sharpless on this, and I'm not sure what our sentiment is in general, I almost feel like the director should give us rationale, give an opportunity in work session for our administrators to present their rationale on these, because we're funding a lot of new initiatives here, right? To me, there's no rationale in a sense.
And I think
here it is. It's just that.
I may be able to explain that a bit, because what's happened over the last 2 years in particular with the reorg is we've really paid attention to the questions being asked, in particular about who's affected, how's it affected, and so today was solely to give you that summary and then let the board do what it typically does, which is put out your listening ear, ask your questions behind the scenes, and then be able to formulate those questions at the next subsequent 2 board meetings, or workshops. But your suggestion of moving it to an information item for today absolutely makes a great deal more sense. So I apologize again for the tardiness last night, But as I looked at it, knowing the timelines that we had, it seemed like, okay, this is just, we're going to share this. The board can then formulate its questions, which is typically the intent of the process of a workshop, and then 2 weeks later having a vote, if it's required, on an item, so that you have the opportunity for over that 2 week period of time to ask those questions. So the next time it comes before the board, we can address those publicly if needed. So it's a matter of miscommunication here. So I apologize, but it has, as Ms. Fields, Ms. Miller, and others have pointed out, within certain areas, it has been an emerging pattern, and so it has been addressed. Yes, ma'am.
And
Because
that's
the
why I didn't hit
expectation-
send, by the way. I didn't hit send because I saw we've got those January dates. So grace was applied.
But cabinet level staff will tell you, I am not reluctant to pull an item if the attachments are not subsequently attached there. So we need to do a better job, and I'll need to communicate better. This is not on staff. This is also my responsibility to make sure I'm putting my eyes on it Thursday evening and ensuring that everything's there. And if it's not, is there a good reason? Because there are times, unfortunately, with all due respect, the last part of the pure process or the evaluation for a contract or something may be sitting on the attorney's desk, maybe sitting on chief of staff. It could be sitting on my desk for signature. So, and that's not Mr. Murphy. That's not a commentary about Mr. Murphy. It's just the final designees that have to sign off on these things, it may be sitting somewhere, and Ms. Winchester then has to make sure that staff scurry and get those things to me. And if it's not going to be done in a timely manner, then we pull the item. So I apologize for the miscommunication. I apologize, quite frankly, for your frustration. And that's why I wanted to seek clarification, because I looked at the timeline differently than you did. So I appreciate your grace and your feedback, and we will make sure that this does not continue to occur. I appreciate it. Mr. Keys.
Well, not missing the opportunity to speak, but being fresh on the board here and maybe with my colleagues, I don't have the opportunity to have frustrations prior. But I will tell you that the way I interpreted, at least via the email that came in last night, and then both documents, especially the second attachment right at the top, dating this is the work session and when it would be on the board meeting subject, I felt like there was plenty of time to review that. But again, like I said, I can't speak on the past. I don't have those prior frustrations, so to speak. But I will tell you that it was my understanding this was informational and we would have time to digest and ask questions. But I do see both points of that. But I just wanted to let you know that I felt comfortable with it and the way it came across.
Sir. Ms. Wyatt.
I just wanted to ask, on those items that you know we won't have an attachment until later, can you just when you send us your weekly note, let us know what those are so that we know to look for them? Or we, when it used to be, before we moved to board docs, we actually got an email when attachments were added. So if there are attachments added, because I tried to do my due diligence before the weekend so that I'm not giving you any questions on Saturday night when I know all you're doing is sitting waiting around for my latest question.
Staring at the phone.
So if we could, just so that we know that those are coming or when they're posted so that we can go back and look at them, that would be really helpful.
No, great suggestions, information item, and then putting that in my weekly updates. Absolutely. I'll be happy to do that. But again, assurances to the board, and I know Ms. Miller and I had an interaction last night because she voiced considerable frustration with the tardiness of attachments, and Ms. Fields has shared that concern before as well. It has been addressed with staff as well, so. Okay. Seeing no further conversations on that, Mr. Chair, the next items up, I think, are donation reports and the rest, so I will turn the workshop over to you, sir.
Thank you, Superintendent. Board members, let's now move to our agenda study. And if you need to find that in your stack of papers, so be it, but I'll give you a moment. So just a couple items we need to work through is our agenda study for tonight, as well as our committee appointments as well. And as you're working through trying to find your agenda for tonight, I just want to remind us when you get your travel memo, if you can please evaluate and then place your signature on that and get that back to Yvette and Linda in a timely fashion. And just bringing that forward to you as a point of information as well. And then as we're doing our travel, making sure that we're submitting our tax exempt forms when you are checking into the hotel. Some of the hotel policies are now changing. We're no longer able to remove any taxes once the transaction has occurred. So those are two items. We don't have technology for our voting tonight, so I won't address that one. But once our items are going through and we're voting on them in our board doc system, I'll try to slow my chatter down a bit as well, just to give you an opportunity to cast your vote through board docs. It'll just make things easier. All right, so if you're ready to go through our agenda study tonight, we'll go ahead and do that. So basically sections A through F. If you have any questions, A through F, that's just our normal, working up to the approval of our consent agenda. Yes, Ms. White, you're recognized.
Thank you. The minutes were updated to show the multiple nominees for chair and vice chair, but they're still showing in favor or against, and they should, is there not a way to show the roll call vote? I know right now it was only 2, so it's, if you weren't for, you were voted for the other person, but there may be situations in subsequent years where we have more than 2 nominees that we should be able to show what the roll call vote was. So if we can get that updated before the meeting tonight. Thank you.
All right, section G through standby. Mr. Sharpless, you're recognized.
I just want to make sure we're clear for, we will not have a board member stepping down for special recognitions tonight, correct? Because we're going to have a performance. Okay, thank you.
Thank you, Ms. Yvette. All right, we're G through J is where we're at. G through J. Okay, section K through M. Section K through M. I'm going to actually ask that K1 be moved to action item. I will not be supporting K1 tonight, so Ms. Yvette, I just want to draw that to your attention, and that is the portable at Shelley Boone Middle School.
Okay.
So, Ms. Yvette, I just draw attention to K1. I'd like that to be moved to action items for tonight. Thank you. All right, so we're in section K through M. If anybody has any other questions. And then we have section N through P. N through P. And Q or R. And that brings us now to our action agenda items. If you have any questions, concerns on that, we will look at our committee appointments to make sure that we're in alignment with our action items for Polk Value Adjustment Committee and the Polk Vision of Directors. And we'll add that motion once we get through that. Ms. Fields, you're recognized.
I had a question on the action agenda 3. Are we going to make those adjustments that we talked about for the legislative platform? Or are we going to delay and submit that for January's meeting?
I can work to add that during our break. Because the only change that we have 2 changes, just to summarize the change as far as the modular, and then there was a request to add truancy and chronic absenteeism onto our legislative platform agenda. So I will add those 2, or make the one revision and add the second one, and we'll resubmit to the board.
Thank you.
Yes, ma'am.
Mr. Sharpless, you're recognized.
That was my question too, Ms. Fields had.
All right. Thank you, Mr. Sharpless. So no other questions on our action agenda for tonight? If not, we're moving on to our public hearing, section T. As noted, this is a combination of 2 sets of policies that we've discussed in 2 separate work sessions. They'll come before us our first time tonight for public hearing. So if you have any feedback, any comments that you would like to suggest as it relates to those, that would be your opportunity as well. And then we'll hear from our public if they have any concerns in those policies as well. And then those will come before us in January as far as an action item. I will read out the individual title and the policy number as we get to that one. And it's a lengthy list as well, just for public record. Okay, so then we have our superintendent's report. Right, and Mr. Murphy, you do have something for us tonight as well? All right, very good. And Ms. Matthews, we do have an appointment. Will you come and present that? Okay, perfect. And Mr. Keys will give you an opportunity to read your letter into the record as well. And then we'll wrap up our comments and public comments, and that should conclude our evening. Any concerns, questions, or anything like that? Very good. All right, so let's take a look at the board liaison appointments for 2024-25. Okay, Ms. Miller, you're recognized.
I can wait. I just, for the public and just for the process, can you just give us an update on where we are in our attorney search? Do you want to do that?
Yeah, at this point, he has been cycling all around, and it's my understanding that he was able to connect with all of you. And then he's been meeting with individual staff members around the district as well. And then from there, the compilation of all of that data will be used to bring forward to us in January the booklet. And if I'm out of accordance, John Murphy, you can let me know. All right. So the hopes are that we would see that in our work session in January.
A booklet of applicants?
No, that would be the booklet that he's using to then. Yep. Mm-hmm.
Okay, thank you.
Correct. All right. Anything else, Ms. Miller?
No, I was just, not that I don't love seeing John with us. I was just wondering how that timeline worked. Thank you.
Yeah. It's definitely good to hear from staff members and their assessment of that time with our search firm as well. Thank you, Ms. Miller. Ms. White, you're recognized.
Thank you. On that topic, I hate for us to wait until January 14th to start talking about when interviews will be, just because coordinating at least the 7 of us, and I don't know who else needs to be in those interviews. Is there any way, do we have a week or any timeline on when those will be, or is there no way to push them on? It seems odd that they can say this is when they should be able to give us a range of timeline. It's confusing to me.
Yeah.
And when I had my one-on-one with him, he indicated that they could at least give us the timeline before the holidays. Is that so that
I could reach out to him and ask on that one.
I just
Mm-hmm. All right. Thank you, Ms. White. All right, so you have your committee appointments in front of you, and we have 2 that we have to vote on tonight, and that is going to be the Polk Vision Board of Directors. Based on your recommendations, I tried to place everyone in what your asks were. The only one I was curious about was, if y'all have an opinion on this, is the insurance and then the superintendent's health strategy committee. I know both Lisa Miller and Kay Fields, you've been on that and serving in those capacities. I don't know if there's any interest of switching with Ms. Miller going to the health strategy and Ms. Fields going to the insurance, but I do think it's important that both of y'all are connected to that and see us through as we make this transition, because you've been with it for a while now.
I'm good with either. I'm good with staying with that. I just didn't know other people, but it makes sense to keep the same people in the process. So I was open to doing whatever the will of the board.
Okay. All right, so Ms. Miller, are you comfortable with the Polk Vision Board of Directors appointment?
Yes, thank you. I appreciate that opportunity.
Okay, thank you, Ms. Miller. And Mr. Keys, for the Polk County Value Adjustment Board, I've slotted you in for that. You feel comfortable?
I'm
filling
fine with that.
Okay. All right, so those will be our 2 action items that are before us tonight. So if we can update the motion, if possible. Do y'all have any other concerns as it relates to to the other committee appointments. Ms. White, you're recognized.
Thank you. Mine is not regarding the appointments, but more how they are communicated. I know last year there was some confusion as to, I'm not getting emails for certain committees. What is the process from today, or is that something I know in previous years our admin connected us with those people, or they at least made them aware this is who the update is. What is the process and what should we expect over the next few weeks in that?
Yeah. So, obviously y'all have had a history as well from as far as a chair role, and any particular strategy that y'all used to make this more effective. I would like us, and this would be for Ms. Wyatt, in board docs where we have the list of committee appointments for the 23-24 committee appointments, for that page to stay active, but then we're creating a separate page for the 24-25. So we can see that historical standpoint as well. I think it's important that we know where we've served historically, as whoever's chairing in the future can see that, because we don't really have a database of where everybody has served in the past, unless we go back to minutes.
Yeah, we used to have those.
Assistant used to keep that.
Yeah,
Do we not have that?
that's a great question.
Do we have a history?
We have to look. She didn't leave anything available to me, so we have to look. I can also call and find out if they can give me history.
We also could, is it in the, I guess the only thing that would be in the minutes are the two that we approve. That document
Right.
hasn't always been attached as of recent years.
Yeah, so, recommendations of how, once these appointments go through, and there wasn't a lot of changes as far as what committees you're serving on.
I think in the past, the way that it has worked the best, at least from my perspective, is that the admin used to send an email connects to the new, who for audit finance, she would send an email to Carol saying, Carol, Dr. Allen's your new person. This is their contact information. Please fill them in. I would recommend us do that even for the ones where we're continuing service, because I still don't think to date I have Polk County transportation information that I'm getting those emails. So if we can make sure that all of those are codified, at least that's how it has seemed to work best in previous years.
Yeah, and you can see there's good progress on who that contact person is per committee. So I think that's good. There's just a couple that we still need to have that solidified as well. And you never know when those change as well. So,
I have an update to this.
Ms. Miller, you're recognized.
I forwarded Yvette an email from the Polk County Transportation Disadvantage Committee that my term is ending, I think, April of 2025. And we really need to work on the alternate. And sometimes it can be a board member. In the past, they said it has been someone in management and transportation. So that needs to be updated. But I think in general, this needs to be coming out of our executive assistant's office and whatever she decides is best. But I've had a couple of these committees who've called me or I've been a part of, and they don't have history either. So there needs to be a written process. We probably have had one in the past because I don't remember it being this way. So if we don't have one, we probably need to look at and that's why I hate that retreat's so late, because I would love to look at some of the processes to make this easier on everyone. But as a board, we shouldn't be calling I think it's the optics of us calling different organizations around the county and saying, wait a minute, I'd rather it be a process to where we know where people have been appointed and we know the timelines of where they've been. So we probably need to work out what that looks like so it works better in the office.
Thank you, Ms. Miller. Ms. Fields, you're recognized.
Okay, historically, everything has always come from the executive assistant's office, and it's primarily been by way of email.
Okay. All right. Thank you very much. So to speak to that a little bit, as we've got our 3 retreats laid out there, it was brought up as a conversation regarding us connecting earlier than that initial April date. And I think Ms. Fields brought that forward before. And you should see in front of you, everybody got the FSBA Master Board training and that opportunity. So I just inquired a little bit with FSBA while we were there this week on that. And their Master Board cycle opens up in February, I believe. And it's a nominal fee of $4,800 for the full master board training, which is one initial 8-hour training and then 3 subsequent at 4 hours. So I'm not sure how much time superintendent is needing for those 3 retreats that we already have scheduled, if he would be willing to allow master board training to be in accordance with those 3. But we could sort of piggyback on those 3 retreats that we already have, but then schedule one sometime in late February, early March to do the kickoff in an 8-hour session, and then use the 3 that we already have scheduled. Not sure how much time you're thinking for those retreat days, superintendent, but just as an option to board members. And if you have other questions on what that would look like, I can send more information your way. I don't have them in my calendar. We had the PDF that we brought forward last week. That's got them noted.
Ms. Fields.
Yeah. Ms. Miller, you are recognized.
I just want to be good steward of the tax dollars. I would like to know what local people are charging for similar trainings. I'm a fan of FSBA. I attended a lot of the conferences. I think it's helpful for this district. I think it's helpful to see what's going on around the state. But almost $5,000 or more on top of 28,000 plus membership. I think I've been questioned about this, and I think to be good stewards of the tax dollar, we need to have at least another opportunity for board training be presented, or at least the cost of it. And it might be an equal share, but it's difficult for me to keep spending money without having at least a bid, not a bid process, but having something to compare it to.
All right. Thanks, Ms. Miller. Ms. Wyatt, you're recognized.
Thank you. I would agree wholeheartedly with that. I know other local entities have used Emily Rogers and some of the other consultants that are out there that are local. And while we do have similarities with other school boards, we also, everything local is a different animal in whatever county you go to. So I think there are some benefits there as well, and would like to see what comparable opportunities there are out there. My question was going to be, are we getting calendar invites for the board retreats? Because I have not seen them come through. Will those come through? Okay, thank you.
Thank you, Ms. Yvette. Mr. Sharpless, you're recognized.
Well, I certainly have no problem with going out and getting different quotes. I would say the one thing that FSBA offers that maybe some local people may not is they have an in-depth knowledge of school boards and how school boards run. They've been doing it a very long time, and so I would just say let's not include them as part of the if we get multiple different ones, FSBA should be one of those.
Yeah, and board members, you need to offer some direction to the superintendent or to our executive on this, because again, this is the will of the board, not me. So y'all are going to have to give direction on what you're wanting to happen. And I see Ms. Fields, you're recognized.
I don't understand. Before I make my comments, you said directed to the superintendent. What are we directing to the superintendent?
Yeah, I mean, well, what are y'all asking? And who do you want, to have this accomplished? I've proposed an option to you, right?
Well, I have been trying to get master board training for a long window of time, and I just gave up on it.
And that's about where I feel too,
And so I think that we need to, thank you, Superintendent Hart. I think that we need to continue to work with Florida School Board Association for the reasons that Mr. Sharpless has mentioned. I mean, we've worked with them before. They have qualified trainers, not that we don't have anybody locally, but they do the work that we do each and every day. And I would just say, don't throw the baby out with the bathwater. So that's just my take on it.
Thank you, Ms. Fields. Mr. Keyes, you're recognized.
I would say along that same subject matter is we need to find out what we want as a board from that and do a cost-benefit analysis if these are the areas we want to cover, to be cognizant of that whoever is going to provide that training, regardless of who it is that meets those standards. And I would, being fresh to the processes of FSBA, I would tell you that another thing to consider also that hasn't been mentioned is statutorily, and those things that we get as this come down from the state that they're well versed in may not be something that a local provider be able to do and speak to those matters as it relates to, but that is a very integral part of what we do. So I would say, that being said, my first statement is saying making sure that we have a list of things that we definitely want to see in something like that, and making sure that those providers all meet those standards that everybody would propose.
Thank you, Mr. Keys. Ms. White, you're recognized.
Thank you. And I completely agree, making sure that FSBA has an opportunity. I think the biggest question is exactly what Mr. Keys just mentioned, of what are we looking to gain from a board? Personally, looking at what I would turn to the superintendent and ask what he has planned for those retreat days, because I think us knowing what's going on locally in our own strategic plan is far more important than some of the master board training, and we have not had substantial opportunities to go over that over the past couple of years. So I want to make sure that he has plenty of time, and then if we have time to do others, we look at that separately. But I would want to hear from Superintendent Hyde what all he needs time-wise, and wouldn't want to give away his time.
Thank you, Ms. White. Ms. Miller, you're recognized.
I just want to agree, and maybe that I didn't articulate that well. What Mr. Keys mentioned is exactly what we need to do. We've had FSBA come years and years ago. I haven't been around that long, but at least 6 years ago, and it just didn't go well. But what we were trying to accomplish was with a different board, and it was different goals. You know, it was communication and how the board reacts and responds to each other, and that's not where we are right now. So I think we need to be intentional in what we're looking for, because what I experienced could be done anywhere. It wasn't something that was about state-of-the-art school board experiences, and I don't know that their trainings are. I would love that if that's what they provide. I mean, if they're going to provide that, but we need to articulate what we're looking for in order to receive the most from it. But the investment piece needs to be very transparent. It needs to be transparent to the taxpayer. It needs to be transparent to the employees, how we spend their money, and we need the most money, the bang for the buck. So I'm interested in, Chair, maybe having people submit what our goals are to get out of this training, and then we can talk about how best to reach those goals. Thank you.
All right, Ms. Miller, thank you. I think at this point, well, let me get the retreat dates out there first of all, so you can put on your calendar. And, this could be something that, Vice Chair Sharpless could lead some initiative on selection and gathering some options for us. And at this point, I mean, it's just really going to come down to consensus of the board in the direction we go. So if the board would be in favor of Justin Sharpless leading to try to gather some resources for us to look at, and at this point, because we have different opinions on this, but it just comes down to, at this point, it's a vote, right? Or consensus of the direction we go. So those retreat dates would be Tuesday, September 2nd. Yeah, where am I seeing September?
We don't meet
Yeah.
in September.
So I see January 9th,
2026.
2026. So is the April date the first one, Superintendent Hyde?
We don't meet at all until next
September.
I think April was the first one, right?
On which one?
April 10th is a Thursday. Yeah.
It's listed as a Friday in your sheet that you gave me.
Because it's 2026.
Yeah, so the first one would be September 2nd. Wow. And then it was January 9th, 2026.
I missed those beats.
Yeah, and then April 10th, 2026. And then there's a workshop on the strategic plan March 10th. Yeah, that's pretty far out.
The problem that we face now is
Yeah.
you're going into the holiday season right now. We're in the midst of the holiday season.
Mm-hmm.
We come back January, we've got school testing going on, and typically there's other events and activities. We go into the end of the school year with March, April, and May, culminating events, celebrations, awards, recognitions, graduations, summer. I can never get a meeting scheduled. So September was the best option for us between now, based off historical calendar concerns and conflicts. If the board wants to try and do something sooner, I am happy to look for a date. I am. So I can work with Ms. Winchester to see what dates are going to work for my schedule. right now and relocate and shift things around as much as I can. And then I can propose some dates and times to the board. It's just historically giving you as much notice. We did have several meetings on the calendar that got canceled. I think there was some confusion at the time about what those meetings were and who those meetings were intended to meet with. But so I think the topic got a little bit conflated. We were dealing with that when we were during the attorney's search and things. So we can definitely go back and revisit those dates, since those were already on their calendars, to see if any of those would still work between now and the end of the school year. Yes, ma'am. Absolutely.
All right, Miss Wyatt, anything else from you?
I did, and I've totally lost it, so I apologize.
All right, Miss Miller, you're recognized.
Yeah, I think it sounds like this needs to be we need to talk about priorities and not meeting with your superintendent in September. He is being very kind. I don't know that that I would, as having to manage a size district and work with this size of a board, I would hope that we could find a date even March. But that's something that we can work on. And I don't mind working with whomever wants to collect our ideas and our goal setting. I just want to run that by our attorney, or if it should go to the executive assistant to collect information. I don't want to be outside of sunshine, inside sunshine. Wherever the wrong side of sunshine is, I don't want to be there. A cloudless sky.
I think any kind of actions should be administrative. If there's any information that's being, and then no conduits, the typical advice. I think that if the vice chair is the point person that interfaces with the admin on that, that's up to you all. How you all want to do that. But yeah, I agree. I don't think it should be, the board members shouldn't be communicating with each other, obviously, outside of a board meeting. Nor should anyone facilitate that.
Thank you, Mr. Murphy. So if this is what we're going to do, now would be a good time to give Mr. Sharpless some direction at this point. But Mr. Sharpless, you're recognized.
Well, how I envision this, the public forum here, is people setting their goals, what they want out of this training, all to our executive Yvette. And then she compile that, as well as any kind of names of any kind of people locally or not that you would be interested in performing this training. And then I could potentially contact and talk to them.
Let me say, I think if there's any distillation of information by the administrative assistant, that needs to come back to the full board, and then the full board can weigh in.
My point is, then I could talk to the individual, just so that way I could get the information to give back to Yvette so she can administer to the board.
The concern I have with that is that you as an elected official are operating off of information you've gotten from your other board members outside of the sunshine.
Okay. All right. Fair enough.
So if you have the administrative assistant in that role, that could be distilled and collated, collected, disaggregated, whatever you want to call it, and then provided to the board so that they can then, in open session, have discussions and come down to whatever it is you want to do.
Yeah. So and here's the thing, it's on you, right? It's on every board member to submit what your goal out of this would be. And, as far as deadlines, to me, I'm going to look at adding this to the agenda, work session agenda, January 28th. That gives you adequate time to submit what your needs are. We have a board meeting that night, and we will have an action item on who we want to choose to handle our board training. And you've got a timeline, and we've got a deadline. I appreciate Mr. Sharpless volunteering or being voluntold. No, I appreciate you step in to do this. So thank you, Mr. Sharpless. Ms. Wyatt, you're recognized.
So I think based on what Mr. Murphy just told us, that timeline can't work because we have to come back to the board to determine what organizations we would even want Mr. Sharpless to look at and get information from. So
yeah.
So
Yeah,
at all,
you
okay.
Direct all your communication to Ms. Wyatt.
Right. I thought that was my understanding. Mr. Sharpless was of the view that
Okay.
everything should go to Yvette.
And then, so I think I need to better understand Yvette's going to gather information from all of these organizations.
Well, she can get facts and information as to their, names, contact information, I guess. But ultimately, it would come back to the board whatever she gathers for the board to decide what you want to do.
Yeah, I would probably differ on this. From the chair perspective, I think it's on each board member to submit their wants to Yvette, right? If you have a contact that you want and you desire, send it to Yvette, then it comes to us as a board to distill on.
Right. That's what I thought we just,
Yeah.
In other words, information can be submitted individually
Yep.
to the administrative assistant, who then gathers it all up, provides it in summary format, whatever, however you wish to characterize it, and then it's presented to the board in toto for you all in an open meeting, January 28th, to then take a vote and decide what you want to do or come to consensus. Whatever it is you decide to do, I think needs to be done at an open meeting so the public has access and hears what you're doing and understands what your positions are, how that works.
All right. Thank you, Mr. Murphy.
Sorry,
I see Miss Miller. Miss Miller, you're recognized.
Are you finished, Ms. Wyatt? Okay, we'll come back. I just want to make sure we're very clear with the instructions were given to Yvette, because I don't know that she's been charged with this in the past. It's going to be finding out what I would, before, like to take a vote, it would be, this is what we're looking for. This is what this company A provides for this much money. This is what company B provides for this much. That's kind of what I see we're looking at. I don't know if that's what everyone sees, but it's going to be disseminating that information. These are the goals the board is looking for. These are who provides it, and this is the cost for the service.
Yeah, I don't know where everybody else stands on this, but I think it's on you, your responsibility, us individually, to go out and find that information and send it to Yvette, right? And then she'll compile, as Mr. Murphy said, and bring it to us and attach it to an agenda item. I think that is conducive to our executive assistant to not overwhelm her with already the workload that she has on her. And I think if this is what we're asking for, I think a simple data collection around something similarly, price point, time, and what the training entails.
I mean,
How would we know what everybody wants? If it's all going to one person, how would we know what the goals are?
well, I think the goals and objectives would be then something you all would establish, correct?
The goals and objectives of the actual training?
Right.
I mean, I think it's typically based on who's conducting the training. They establish what those goals are.
They usually facilitate.
They facilitate.
I'm sorry. I don't mean for this to be complicated, but it's just whatever you all do. I just want to make sure that you do it in a manner that's consistent with Sunshine, and I know there's nuances to that, maybe at times, but to the extent that you have, there's a spectrum of action, and I just want to make sure that at any point along that spectrum, if there's actions or consensus or things that are the board's purview, that you are doing that in a board meeting and not having it viewed like, oh, well, this is, I don't know if I'm expressing that clearly, and not that anyone is intending to do that, but I just think that's the view that I have, is that you should be doing whatever it is you're collectively doing as a board at a meeting, however that works. That doesn't mean individual board members can't give something to your administrative assistant for her to gather facts, but anything that would be done would then be presented back to the board, ultimately, for you to either say it's important or it isn't, or yes, no, maybe, whatever you all decide.
Ms. Miller, you are still.
Yeah, I mean, that's the usual, and I'm just speaking of past and other boards I've sat on, that's the role of that position, to bring the facts to the group as a board, and then they decide based on what they had submitted. So because you can have a facilitator who does organizational management, you can have a facilitator who does communication. So they're only going to provide what we give them, but one person, and it's usually the executive assistant, gives them the information, not individual board members, because then you're going to get accused of trying to sway votes, and It just doesn't look good. The optics are bad, even though I know no one here has the intent to do anything outside of the sunshine, in the sunshine, the wrong side. But you have to be very transparent in the process, and that's why we have someone in that role. That's just my past experience. But you know who's had the most experience? Miss Fields. And so she probably
Well,
has.
there's no reason to reinvent the wheel.
Right.
I mean,
right.
this is not something that's new.
Yeah. I mean, at this point, Miss Fields has expressed her opinion and her experience, and I value what she said. I mean, it's in essence, at this point, who's gonna, I don't know, I could say a lot more on this, but I'll yield. Miss Wyatt, you're recognized.
Thank you. So my concerns are that and I think, Mr. Keys, when he started, and several of us agreed with his comments on what do we want from our board training. Is it that we want something that's much more on, state statute and what our rules are? Is it more working together cohesively as a team? I think we have to determine what training we are looking for before we can all go, because if not, then we're all if we each contact a different company and say, hey, this is what, I don't know what we're asking them for unless we know what, as a board, we have collectively decided we want to ask for. So I guess that's where my confusion is, I know the things that I feel like would be beneficial from my perspective, but those may not be the same things that would be beneficial from anyone else's perspective. So I think it's important for us to have that conversation. I know that we didn't know that this was coming up today, so I don't know if it would be appropriate to have that conversation today or at our next work session, but I think it's important that we have that conversation before we go out soliciting proposals that we don't really know what we're asking for. And I think it's, to Mr. Murphy's point, we have to have hard conversations at the dais because that's the only time that we can talk. So we can't, it troubles me when we try to put those things off on our admin, just because I think that we've been elected to have those hard conversations and we need to be doing that at the dais.
So with that, I mean, what is your direction then to our executive assistant then? Miss Wyatt? Miss Fields, you're recognized.
Okay. I'm thinking, and I am remembering, and it appears to me from previous experiences, the superintendent and the board chair have gotten together and created an agenda. That agenda is then given to all the board members. If there's anything that's missing, anything that they want to add, then that's done. And then the agenda is created at that time. And who facilitates is based on what's on the agenda. Is it the Florida School Board Association? Is it somebody local? Is it the superintendent and his team? That is the way it has been done. I think we're making this too hard.
And so what is your recommendation, Ms. Fields?
I just gave you my recommendation. You and the superintendent get together. You all look at what you think we need to focus on. Superintendent already has some ideas about what he thinks. Okay? You can go back and look at something from previous times and then distribute that to everybody here. And then everybody has a chance to input or ignore it. And then you bring it, and then we can get who's going to facilitate it. Is it going to be the superintendent and his team? Is it going to be someone from Florida School Board Association? Somebody local? That's my take.
Thank you, Ms. Fields. Mr. Nolte, you're recognized.
I agree with what Mrs. Fields said. She's got a great experience. And I really feel at this time, we need to probably go out there in the hallway or somewhere and find a live horse, because I think this one in here is dead.
All right. Thank you, Mr. Nolte. All right. Any other comments? All right. Well, if we have no other business to come before the board. Superintendent, you did remove your comment.
I think Ms. Fields captured my comments. Frankly, historically, that's what you and I had done previously. Again, because I think it got conflated with some other topics and other issues. those meetings. There are topics that are already on the agenda for those meetings. Happy to work with the board to provide partial portions of that time to do whatever facilitation needs to be done. But to Ms. Field's point, in addition to my topics that I feel are urgent, rezoning, big items that the board's going to have to spend some time on with me, I would very much like to have the opportunity to poll the board, and I can work with yourself and Mr. Murphy to see what other topics there are that we should be addressing. Whether it's school finance, whether it's, safety, other topics. I mean, I think there's an opportunity here to capture what some of your needs and interests are as well, and have that blended forum like we attempted to do before. And then based off those needs, we can determine whether or not there's already an established person or group that can facilitate that portion of the conversation, or we can go out and look for that person. But I don't think looking for that person randomly at this point makes much sense outside until we refine what the interests and needs of the board are. So you, myself, Mr. Murphy, right now can work towards that. And I can definitely work with Mr. Murphy to develop the survey tool to make sure it operates the way it should be legally and in the sunshine, and then share that with you, and then ultimately share that with the board so we can get their feedback.
All right. Thank you, Superintendent. At this point, the meeting is adjourned.